Di ba normally when it's a heart attack, it's here daw, or masakit yung chest, parang may mabigat.
Lagi akong hinihingal, which na dati naman po hindi ako hinihingal.
I felt heaviness in my chest for the first time.
I felt relieved because at least it was diagnosed.
Very anxious, very scared.
This was very unusual. It was the farthest thing from our minds na it was a heart attack.
Nagpa-2D echo po ako. Nag-stress test din.
I have three vessel black artery. Sabi nung cardio, kailangan na ng bypass.
So altogether, 7 blockages, which they put stents in.
Lumakas naman ako, hindi na ako hinihingal.
It was as if nothing has happened to me. I mean, it was an immediate relief.
Parang kung brand new machine. I was doing boxing, I was doing intense, nag-HIIT ako, ganyan.
We should all listen to our body. Anything unusual, you go to your doctor and have it checked.
Maganda, magpa-check up agad kung may nararamdaman kahit konti.
Whether there's a symptoms or not, because this is a good way of preventing the possibility of having a heart disease.
I feel secured with the results that I get.
I'm confident sa state-of-the-art facilities ng St. Luke's. Saka, yun, sa mga specialized doctors nyo.
As soon as I said heart, chest pain, they immediately put me up in the front of the line. Would certainly recommend going to the most state-of-the-art hospital in the Philippines. And I think that's St. Luke's.
Hi everybody, it's Martin Rivera reminding all of you to please wear red on the first Friday of February to raise awareness of women's heart health. A healthy heart of a woman makes her hot. No?
Hi everyone, this is Tirso Cruz III asking you to please wear red this first Friday of February to raise awareness about women's heart health. A woman with a healthy heart is beautiful. Let's all help out.
Yes, hello guys, this is John Arcilia and I would like to invite everyone to wear red on the first Friday of February. It is to raise awareness on women's healthy heart. Because for me, women with healthy heart means a healthy community. So there, don't forget, wear red on the first Friday of February.
Hi, this is Lorna Tolentino inviting everyone to wear red today, February 4, 2022 to help raise awareness on women's heart health. Thank you!
Smooth like butter, like a criminal undercover. Don't pop like trouble, breaking into your heart like that. Cool shade stunner, yeah, owe it all to my mother. Hot like summer, yeah, I'm making you sweat like that. Break it down. Ooh, when I look in the mirror, I'm not too hard to do. I got the superstar glow, so do the boogie line. Side step right left to my beat. I like the moon rock with me, baby. Know that I got that heat. Let me show you, 'cause talk is cheap. Side step right left to my beat. Get it, let it roll. Smooth like butter, pour you in like no other. Don't need no usher to remind me you got it bad. Ain't no other that could sweep you up like a rubber. Straight up, I gotcha, making you fall like that. Break it down. Ooh, when I look in the mirror, I'm at your heart to do. I got the superstar glow, so to the boogie line. Side step right left to my beat. I like the moon rock with me, baby. Know that I got that heat. Let me show you, 'cause talk is cheap. A side step right left to my beat. Get it, let it roll. Get it, let it roll. Get it, let it roll.
Eyes on my wrist, I'm the nice guy. Got the right body and the right mind. Rolling up the party, got the right vibes. We like haters. Fresh boy, pull up and we lay low. All the players get moving when the bass low. Got army right behind us when we say so. Let's go.
Side step right left to my beat. Right left to my beat. I like the moon rock with me, baby. Know that I got that heat. Let me show you, 'cause talk is cheap. Side step right left to my beat. Get it, let it roll.
Moonlight, cool shade, and you know we don't stop. Highlight, ain't no. You been like, oh my god. We gon' make it rock in his head. We gon' make it bounce in his head. Hotter, sweeter, cooler, butter.
Get it, let it roll. Smooth like butter, like a criminal undercover. Don't pop like trouble, breaking into your heart like that. Cool shade stunner, yeah, owe it all to my mother. Hot like summer, yeah, I'm making you sweat like that. Break it down. Ooh, when I look in the mirror, I'm not too hard to do. I got the superstar glow, so
Do the boogie line.
side step right left to my beat. I like the moon rock with me, baby. Know that I got that heat. Let me show you, 'cause talk is cheap. Side step right left to my beat. Get it, let it roll. Smooth like butter, pour you in like no other. Don't need no usher to remind me you got it bad. Ain't no other that could sweep you up like a rubber. Straight up, I
Gotcha.
making you fall like that.
Break it down.
Ooh, when I look in the mirror, I'm at your heart to do. I got the superstar glow, so
To the boogie line.
side step right left to my beat. I like the moon rock with me, baby. Know that I got that heat. Let me show you, 'cause talk is cheap. A side step right left to my beat. Get it, let it roll.
Get it,
Let it
I'm the nice guy. Got the right body and the right mind. Rolling up the party, got the right vibes. We like haters. Fresh boy, pull up and we lay low. All the players get moving when the bass low. Got army right behind us when we say so. Let's go.
Side step right left to my beat. Right left to my beat. I like the more rock in me.
Women of the Philippines, let's take time out to take care of our hearts.
Join the lay forum of the Women's Heart Health Unit on St. Luke's Medical Center on March 4, 9 a.m. to 12 noon via Zoom.
Hi everyone, this is Julia Montes. Heart disease is not exclusive to men. Women should be aware that we are prone to heart disease also. And we need to take care of our hearts as well. Join St. Luke's Women's Heart Health Unit Lay Forum this March 4, 9 a.m. to 12 noon on Zoom.
Ladies and gentlemen, good morning. Our program is about to start. May we request your kind attention to the screens in front of you for the opening prayer to be followed by the Philippine National Anthem.
Let us put ourselves in the holy presence of God. Father in heaven, always merciful and giver of life, we humbly ask that you bless each one of us, from the speakers, program committees, guests, and participants. Guide us to make better decisions as we incorporate what we will learn throughout this activity. Lord, today as we start our activity, may we always be grateful to learn new things. Shed the light of your wisdom and bless each one, especially our speakers, as they will share their knowledge to us. Through your mercy and grace, may peace and utmost understanding shine and dwell unto us. Almighty God, accompany each one and help us concentrate for us to gain more knowledge as we listen attentively. This we ask in your name. Amen.
Bayang magiliw, pwes na silanganan, alam ng puso, sa libid mo'y buhay. Lupang linirang, tuwing ka nang magiting, sa manlulupig, di ka pasisigi. Sa lagat at bundok, sa simoy at sa langit bumagaw, may dilatang tula at awit sa paglayang minamahal. Ang isat ng mataw at may tagumpay na nagniningning, ang bituin at araw niya kailan pa may di magdidilim. Lupa ng araw ng mahagi pagsinta, buhay langit sa piling mo. Ang ligaya na pag may mga api, ang mamatay ng dahil sa'yo.
Good morning once again, ladies and gentlemen, and welcome to the St. Luke's Heart Institute, Global City, Manuel and Grace Palaganas Women's Heart Health Unit, and St. Luke's Medical Center, Global City, a Wear Red Day event, the Heart of a Woman Lay Forum. And to start off our program, we would like to welcome, she is the head of the Heart Institute of St. Luke's Medical Center, Global City, is the past council chair of heart failure, women's cardiovascular health, pulmonary hypertension, and core pulmonary critical care of the Philippine Heart Association, is a past assistant medical director for medical education at St. Luke's Medical Center, Quezon City, and is a former assistant dean of the St. Luke's Medical Center College of Medicine, William H. Quasha. Memorial. Please put your hands together for Dr. Maria Adelaida Ibolion, D.
Each year, heart disease and related risk factors are missed in women. If you're a woman or care for one, I admonish you to listen up. Heart disease is the leading cause of death in women, not only in America, but also in our country. Symptoms of coronary artery disease and heart attack, for example, can be different in women than in men. Women are also less likely to receive the recommended treatment for certain heart conditions. If you're like most women, you're probably so busy taking care of everyone else, your own well being and health tends to fall last. But you need to make your heart's health a priority and encourage other women to do the same. Even though heart disease tends to strike later in life, it can happen at any age. Unfortunately, more events are happening in women younger than 50. There are things about being a woman that can make you more prone to heart problems. For example, certain health problems during pregnancy, treatment of breast cancer, menopause, and hormones. Learn about your risk for heart disease and what you can do to lower your chance of developing it. You can help protect your heart by adopting heart-healthy habits. For example, by exercising, eating right, getting enough rest, not smoking, and focusing on your health in general. If you already have heart disease, you're in good company, as millions of women are living with some form of heart disease. They can provide a wealth of advice to help you on your journey. Remember that prevention, early and accurate diagnosis and treatment are critical. We hope too that through initiatives such as these, we can help curb the menace and better understand the heart of a woman. On behalf of the Heart Institute of St. Luke's Medical Center, Bonifacio Global City, I thank the section of Women's Heart Health, headed by Dr. Joanna Manalo, for organizing another interesting forum, and especially extend our gratitude to our distinguished speakers and guests. We hope that you enjoy the forum as much as we have enjoyed organizing this for you. Have a good day.
Thank you, Dr. Lenny D. Now, to give us her welcome remarks, please allow me to introduce. She is the chair of the Council on Women's Health of the Philippine Heart Association, is the chief of the section of cardiology at Jose Reyes Memorial Medical Center, and is a cardiology consultant and professor at the University of Santo Tomas Hospital. Please allow me to welcome Dr. Eileen Cynthia F. De Lara.
Women's Heart Month is a great time to celebrate. And yes, March 8th is the International Women's Day that is celebrated all throughout the world. Yes, you are all amazing women. All of us deserve love, care, respect, and happiness. Throughout history, the contribution of women to every sphere of life is massive. We play an important role in society, and the whole family is dependent on us. We are daughters, mothers, wife, homemaker, teacher, nurse, doctors, all at the same time while catering to everybody's needs. Our life is hard, but we get things done. There is no limit to what we can accomplish. Let everyone knows our value and importance, because we deserve to shine with equal opportunity as it is given to any man. Glad that we get this honor of recognizing and celebrating our efforts today. Remember, there is no man's day. So let us celebrate and remember we are warriors fighting without swords and conquering through love. Happy Women's Day, everyone.
Thank you, Dr. Cindy De Lara. And now, to help guide us through our sessions for today, allow me to introduce our Master of Ceremonies and moderator. She is the head of the section of heart failure at the H.P. Calleja Heart and Vascular Institute at Quezon City. She is the director for the Philippine Heart Association National Heart Failure Network and is an active consultant at both St. Luke's Medical Center Global City and Quezon City. And lastly, she is an advocate of women's health at St. Luke's Medical Center Global City. Ladies and gentlemen, please put your hands together for Dr. Erlene C. Demere.
Good morning, everyone. Thank you for that kind introduction, and thank you to the organizers who worked hard to bring you today's event. Thank you all for being here, wonderful women and lovers of women. Well, you just heard the voices of women conquering heart disease and the powerful voice of women leaders like our current and first woman director of the St. Luke's Heart Institute, Dr. Lenny Ibolyondi, and Dr. Cindy De Lara, the chair of the PHA Council on Women's Health, who are both staunch advocates of women's heart health. Now, this is really a special time, guys, for all of us to be together, the lay and even Dr. guests, on this virtual stage to focus on cardiovascular health, especially in women, and raise awareness and hopefully lower the risk of heart disease, especially in women. Now, this is brought to you by the Women's Heart Health Unit, dedicated to heart health issues in women of all ages and ranges. And this has become a priority section of the St. Luke's Heart Institute Global City. Dr. Ibolyondi and her predecessor, Dr. Nick Cruz, have set the stage for this dynamic unit that is now ably headed by Dr. Joanna Manalo, who herself is one cardiologist who values healthy lifestyle, not just as a fad or attached to her position, but as a lifestyle. So let us take on the challenge of Dr. Lenny Ibolyondi and all the other women that were here, to take care of our hearts. Listen up, she said, take care of our fragile hearts beyond all the hype of celebrations like today. Okay, let's make it our priority. And of course, Dr. Cindy De Lara tells us that we deserve to shine, women, for we are warriors, warriors without swords, warriors to conquer and fight heart disease, okay, by being healthy ourselves. Because many women really think that heart disease is a man's disease. Well, definitely it isn't. That's why we're doing all of this. The heart disease is the #1 killer. A lot of women don't know that. So whether you already know it or you still don't know it, you need to know more, you are in the right Zoom meet, for the organizers crafted a great program for you. So stay tuned. You still have time to invite others. They can still come in because we have now a power pack of speakers for you. So let me just introduce to you our speakers for today. Okay. I'll introduce all of them together, and they will also just continually speak as they come, right? So our first speaker is a very good friend of mine, and she's really a symbol, an icon of health. Okay, she's Dr. Helen Ong Garcia. She's the Vice President and Head of the Quality and Patient Safety Group here at St. Luke's Medical Center, and she's the Chief Quality Officer of St. Luke's Medical Center. But beyond all of those titles, she is a woman that you would really want to emulate. Health and wellness is her game. So let's welcome Dr. Helen Ong Garcia. Now, Miss Cassandra Serio is also one of our gems in St. Luke. She's a registered nutritionist and dietitian. She's an assistant diabetes educator, and she's also part of the weight management team as a dietitian of St. Luke's Medical Center Global City. So it is really a privilege to learn from the expert in diet and nutrition, Ms. Cassandra Serio. And last but not the least is Dr. Frederick Cheng, again, an icon of health, right? Dr. Frederick Cheng is the head of the accreditation committee of the Specialty Board of Adult Cardiology, and he's the head of the diagnostic division of the HB Calleja Heart and Vascular Institute, St. Luke's Medical Center, Quezon City. And he is the head of the Ways and Means Department of Internal Medicine, St. Luke's Medical Center, Quezon City. But again, above all those titles, Dr. Frederick Cheng is one cardiologist who walks the talk. He does what he says. So it's exciting to have him on this platform, and we will learn a lot from him where exercise is concerned. So I give you now the three speakers who have prepared a good talk for you guys, and stay on because we will have a question and answer portion after all their speeches, after all their talks. So let's welcome again Dr. Helen Ong Garcia, followed by Ms. Serio, and then Dr. Frederick Cheng. Thank you.
Good morning, everyone. I hope, Erlene, can you hear me?
Yes, we can.
Thank you very much. Thank you. Good morning, everyone. Allow me to speak now, Erlene, then to start my lecture.
Yes, go ahead, Helen.
Okay. Magandang umaga, everyone. Thank you, everyone, for this opportunity. I'd like to thank the organizing committee for this opportunity to talk about something that is actually very, very factual now in my life. At the same time, very, very relevant, because I think I like to share with everyone the journey that I'm also undergoing now as we talk about heart disease and menopause. And I do love the tagline. I'd like to thank Dr. Sam Delgado and Dr. Adanica and Laicano, my junior colleagues who actually collated these slides for me. And now I'm about to do my job of delivering it for them. Maraming salamat po. So the tagline was very hot. It's very, very apt because it said, I'm still hot, but it just comes in flashes now. Women are actually measured by a lot of norms that we don't really agree, and the emancipation of women has gone a long way since the very beginning. But then we do agree that there are some things that we cannot change, and one of them is what is inside our body. So sometimes
Good morning, Dr. Helen.
Yes, po.
Dr. Viber is the one being shared. The slides haven't been shared yet.
Oh, I'm sorry.
Thank you, Dr.
Let me see. Okay. Sorry, thank you for that. Thank you. My God, nakita niyo mga Viber messages ko tuloy. OMG.
It happens, Helen.
I know. Buti na lang you did not see all my boyfriends there. Of course, Erlene knows I have only but one boyfriend. Let me try to see. I think I have it prepared already. There it is. Just tell me na lang. Can you see it now? Are my slides being shared, or am I sharing something that is not supposed to be shared?
Not yet, Doctora. It's still the Viber po.
Oh, maybe I would stop share first for a while and then probably ask help already from the organizing committee. I might be meeting some technical difficulties. That's one of the problem also being at my age. Technology has really surpassed me. Can I ask perhaps the organizing committee to share the slides for me instead? Will that be okay?
Dr. sharing your slides.
Thank you very much. Thank you. Please beg your indulgence. I may be good in a lot of things. I may be quite passionate about things. Technology is not one of them. I married my husband with one of the assets that he has is being good in technology. But of course, we're almost the same age. So as we grow old, so does our knowledge about technology go lower. It's actually inversely proportional. So that's why his love prevails too. So that's why along this journey is very important too. So that's the slides already. Let me go through them. As I mentioned, the tagline is very good. I'm still hot, but it comes in flashes now. And I would like to disagree. I'd like to disagree. If we rate ourselves as being judged by those norms, including our hormones, if we used to be hot, we want to rate ourselves as 100%. It's only a percentage that will go down when you actually go into menopause. It's a mindset. And therefore, I will tell you then what we need to do so that we don't get actually burdened by these norms that we're actually being restricted on, including our hormones. Next slide, please. Now, menopause is really a normal phase of women's life. For most of women in their 40s and 50s, sad to say, this is also determined by the fact that when your parents or when your mother or aunts actually have their menopause, that's the time you actually will also predict that you'll get your menopause. Now, going through menopause does not mean 100% you're going to have cardiovascular disease. It increases the propensity or the probability. So there's still a choice that's there that you can actually make a difference so that you don't become one of the numbers that actually has menopause is equal to cardiovascular disease. Next slide. Why is that so? Because we do define them at phases where you can actually act and actually change the course of your cardiovascular history. We have what you call perimenopausal stage, wherein it includes the most symptomatic years. And this is the key time. This is the time when menopause is about to set in, that you can actually make a difference in changing the course wherein you become one of the patients of the cardiologist. Now, when women stop their menstrual cycle permanently, for which I know a lot of women in the room who are undergoing menopause will say it's a liberating moment for most of us because we don't have to worry about a monthly thingy. Number two, it does have some cost effectiveness because now we are not making those things in the supermarket earn money. But besides, kidding aside, this is the time that we actually say you're menopausal, when you actually stop having your menstrual cycle. And it's something that we don't need to measure hormones. Your hormones may still persist despite having no menstrual cycle, but it's good to have that mindset because the moment your menstrual cycle stops and it's persistent for about 3 months, then probably you have to start planning how you can make sure you don't become a cardiac patient. And when we are postmenopausal, that's the time we actually say the hormones have dropped to the level that there is no more protective effect. Next slide. Now, why do I say no more protective effect? This particular slide will tell us how the estrogen actually rises and goes down and further down as we go into our menopausal state. So it is actually quite abundant to start to become abundant at 20. Then when you reach 35 to 40, that's where the abundance of estrogen is there. So that's why sometimes it's not surprising. Some people will say the new 20 is 40 because 20 was determined by, history and environment and culture. 40 is determined by women. But at the age of 50, it starts going down. That's when our waistline that we used to maintain at 28 starts creeping up. That's also the time we actually have the hot flushes. For women, some women, they're earlier, some are actually later. And when you reach the age of 60, it comes down and down. And then the reason I say the protective effect, it has been known that having a lot of estrogen does confer a certain cardiovascular protection for women. So I always say if men have prostates, women have menopause. So if you marry a husband that's about your age, you have different concerns medically that you need to address quite aggressively. Next slide. So early menopause does occur, and that's where we actually would like to highlight to everyone. When you have your organs that produces the hormone removed earlier, and that's what we call surgical menopause. And we have actually chemical menopause, when you actually have some medications that actually alter with your hormonal balance in your body. And it's considered premature if chronologically at age, it occurs at the patient when the patient was before the age of 40 and between the age of 40 to 45, for those whose menopause is supposed to come later. So those who experience earlier menopause, which means besides the one that I showed you, that the estrogen level going down up to the age of 80, it occurs earlier. So whatever that comes after menopause, you might experience. So you might want to appreciate if you're one of those people who actually have surgical removal of your ovaries, or you actually take some medications that alters your hormonal balance, you might want to consider going into some of the things that we're going to say that would actually prevent other disease from coming in. Next slide. So let's take a link. I mentioned menopause does not automatically mean that you're going to have cardiovascular disease, but the question is, how does it link? Next slide. So after menopause, as I showed you, women produces less estrogen and progesterone. Now, as mentioned, this does not make you become hypertensive immediately, does not make you have a heart attack immediately. No, this changes actually confers a probability, a vulnerability to changes in the bone, changes in your dental stature, and even cardiovascular disease. Next slide. And how is that so? Now, menopause actually will make your estrogen go down, and therefore there is actually hot flushes and night sweats. And I can tell you, as I'm experiencing, it's kind of a little bit not comfortable. And then you start sweating, you used not to sweat, but it does happen. It does have a certain amount of depression because now the happy hormone is actually going lower. And of course, psychologically, you know, you don't have menstruation anymore. A lot of psychological things will come in. Am I still attractive? Will people think that I'm actually growing old? Will my husband look at me with the same eye, or else I will kill him? Again, joking. Sleep problems. You find yourself having problems also with sleep, and it does occur. And the body fat around the organs occur inside the body. At the same time, outside, your abdominal girth becomes a little bit bigger. And then you notice that it's a little bit more difficult to maintain your used to be very nice shape. And the cholesterol levels started to come up. There's also stiffening and weakening of the blood vessels. So with all of this on board, you might develop diabetes or high blood sugar. You might develop actually an increase on your bad cholesterol and a reduction in your good cholesterol. Triglycerides might go up, and you might develop high blood pressure. So these things occur when whether you have surgical, chemical, or natural menopause. And therefore, I mentioned a vulnerability to develop cardiovascular disease. Next slide. So three or more of the things that I mentioned that you might develop if you don't intervene early will be what we call cardiovascular risk factors. These are common cardiovascular risk factors that we actually look for in patients who have developed a stroke or heart disease such as a heart attack, or even peripheral vascular disease for those who develop active blockages in the legs. So these things are actually modifiable. So which means that if you do recognize that you are perimenopausal or actually even menopausal or even postmenopausal, of course, the earlier the better, you might prevent these things from coming in, and you might live life to be 80 and still hot. And that's the figuratively hot. Next slide. So the good news, we can make a difference. It's never too late. We don't throw in the towel just because we lose our menstrual cycle. We celebrate the loss of that particular monthly agony of trying to deal with menstrual cycle. We celebrate the presence of menstrual cycle as because it represents our hormonal abundance, but we also celebrate its loss because it's a new phase in our life that we don't have to change anything that we do. We just have to strategize to make sure we still enjoy what we're doing. Next slide. Dr. Ebolian mentioned exercise regularly. To be honest with everyone in the room, yes, we do exercise regularly, but I would advise everyone to modify your exercise. If you used to be a beast, it's time now to be a tame beast. Or not, don't be a beast, be just an exercise animal that actually does it appropriately to age. Because as mentioned, menopause does have some effects also on our orthopedic status. So if you try to do the Pilates advanced level that you do, make sure you are conditioned enough to continue that. But if you're just starting your exercise, start accordingly and improve. Because the more important thing is, rather than the intensity, is to exercise regularly, appropriately. Asking help from a fitness trainer, from experts would actually help you have an exercise program that is both fit for your age, for your conditioning in terms of your body to adapt to exercise, at the same time for your orthopedic status. Next slide. Eat healthy. I should actually probably reiterate, this is not something that you do only when you are about to undergo menopause, because of the fact that across all ages, regardless of what age of women, whether you have estrogen or not, eating healthy should be a norm. I actually started to actually teach my women patients to even implement martial law at home regarding eating healthy, because there's no such thing as kawawa naman ang mga bata. Because the children will inherit our genes. The children will inherit our eating habits. So teaching them to eat healthy early is ensuring them that what we've learned of this life we can pass on to them that they have a more productive and more fruitful life medically compared to us. Next slide. Quit smoking. Smoking does have on itself, without even the help of menopause, give us a certain increased risk to develop heart disease, cardiovascular disease. So as early as now, you can quit smoking, and then it will have a long-term effect of making sure you enjoy life better, even perimenopausal or postmenopausal. And of course, the effect of smoking on your skin, on the turgor of your skin, on the way you look, the glow that you actually look, will actually help too. Remember, now appearance we need to maintain at the liking of what we want. So we probably want to reduce all of those habits that actually could contribute to us to age earlier. Next slide. Manage stress. I'm sure this is something that during the pandemic, all of us are actually quite worried about across all ages. So most so with patients who are undergoing menopause. Because of the fact as mentioned, this is reality check. No matter how positive you are, no matter how brilliant you are, or no matter how forward-looking you are, menopause does confer a change in the phase of your life. So which means when you're undergoing menopause, a lot of things come into your mind. And one of the stressful things is the perspective that you're about to undergo a change. So I think early on, you should have a mindset, as mentioned, that this is a phase, normal phase in my life. I will not let it dictate how I will be in the future, but I will go on. The passion of what's driving me should continue. And I will not let something that is natural dictate that I should be following what a menopausal woman should do. In the same manner, I would say, if they say the woman's role is at home, we change that. More so, we can change internally that menopause will not change what I will be in the next decade or so. Next slide. Find support. It's very difficult to undergo a normal phase in life alone, especially if you're only married to a male creature of the world. So which means talk it out. Talk with somebody who undergone menopause. Sometimes it could be your relative, it could be your parent, it could be a friend. It might be nice, especially if you're undergoing depression regarding this, because it is identifiably a major change in your life. You might actually start throwing away clothes that make you look hot before and start to find a new way of defining you. Because this will then persist for the next few decades of your life. You are going to be postmenopausal. And the way you look at it will have to come into a certain way of strategy of looking into your life and making sure you achieve that phase that you want. Early on in my life, I actually decided that when I reach menopause, I will stop wearing mini skirts because I think I would like to be appropriate for my life. And I think that is the way I think we plan ahead. For those who are not yet menopausal in the room, plan ahead. These are natural phases. It's just like planning for school after elementary, high school, college, and then postgraduate courses. What do I want to look like? And then you will meet the expectation that you set for your life in your, so there's no defining, nobody else could define who you will be on who you are now except you. Next slide. Get screened. As I mentioned, it's a natural phase or phase of women. But I think this is the last or almost the last slide because we cannot change what normally occurs in our body. What we can do is just, again, as I mentioned before, do what we can do at home. But more importantly, there are hormonal changes that are occurring in your body. And the best way to prevent disease is to actually get an expert. Get somebody who can guide you to make sure that you do all the preventive measures to avoid disease. Cholesterol is something that is not expressive. When you have high cholesterol, it just creeps up in your body. And lo and behold, when you discover it later, it's actually high. Denying that it actually occurs in your body could lead to more problems. So get screened. Go to our women's health clinic. Get yourself screened. Do the necessary laboratories because the main goal is to continue life as though menopause did not occur. So if we're going to do that, we need somebody, we need a personal friend, a personal doctor who's going to make sure that my organs inside are still functioning well so that I can do what I want outside of the clinic. So get screened. There are a lot of tests that we need to do because as your hormonal level goes down, doctors recognizes what particular part of your body needs to be screened to make you avoid heart disease. This particular person here actually had a recent blood chemistry, and despite being a very avid exercise aficionado and health guru, question mark or quotation mark, my cholesterols are up. I thank my parents for that, because for me to know that my cholesterols are up now means most probably I'm doing the right thing. And also being a doctor affiliated with St. Luke's Medical Center and having myself checked, now I'm taking medications to correct that, because I still want to do a lot of things and I'm not going to be governed by the natural changes that occurs in my body. So there's some things you cannot do at home and your doctor could do that for you. Next slide. So these are just a very big screenshot of what we need to do. Get plenty of exercise, eat healthy, quit smoking, manage your alcohol intake, manage your stress, and know your numbers. What are your blood pressure? What is your BMI? What is your cholesterol level now? And how are your sugars done? And the knowing your numbers should direct you to your doctor, or even if while you're knowing your numbers, you should have a doctor beside you. So your new BFF now includes a doctor. Next slide. So with that, I'd like to thank you. If you have any questions, feel free to email that particular email. Of course, feel free to email or call our Women's Health Clinic, because they are the ones who actually are very much experts in handling women in all the complexity and beauty what a woman has. Thank you very much.
Thank you very much, Dr. Helen Ong Garcia, for our first lecture session. Of course, we are reminding all our participants here in Zoom and on YouTube, you can post your questions in the chat box and they will be addressed by our speakers at the end of our third session, where we will have Q&A segment. Now, to proceed with our lectures, we would like to welcome our second speaker, Ms. Cassandra Serio.
Good day, everyone. My name is Cass. I'm a registered nutritionist dietitian and a certified assistant diabetes educator. And I'm here to have a healthy heart talk with all of you on how to make a nutritious meal plan. So as part of the celebration of the Women's Heart Health, it is nice to note that the rising incidence of CVD or cardiovascular diseases over the last 25 years has become a public health priority. But it is also good to know that lifestyle interventions such as healthy dietary pattern shows a greater magnitude of beneficial effects for preventing CVD, and not only these, but also other chronic diseases as well. So the question now is to how to make a nutritious meal plan. So in order to do that, there are 3 easy steps to remember. 1 is moderation, 2 is balance, and 3 is variety, or simply put, mobava. First step in making a nutritious meal plan is to eat in moderation. So eating in moderation means eating only as much food as your body needs, because at the end of every meal, what we want to feel is satisfaction. So we eat simply because we want to satisfy our hunger. And but not feeling stuffed and uncomfortable after. So in eating in moderation, remember to acknowledge your body signal whenever we're full or whenever we're hungry. So whenever we're hungry, nandiyan yung signal ng katawan natin na sumasakit yung tiyan natin or tumutunog yung tiyan natin. And whenever we're full, nagsisend din yung ating katawan ng signal by burping. Nandiyan din yung nafe-feel natin na bumibigat na yung katawan natin. Eating in moderation does not mean completely removing the foods that you love, but rather eating them just in the right amount. But how do we make sure that we are eating in moderation? First step is to consider small portions. So we may practice this one by, for example, we are eating outside. So you may do this by ordering a starter instead of an entree, by splitting a dish with a friend. But of course, right now that there is a pandemic, this may not be a safe practice, but you may try it out. And of course, avoiding supersized orders or large meals or upsized meals, for example. Number two is to take your time. So it takes a few minutes for our brain to signal that we're already full or we're hungry. So eating slowly may help you prevent yourself from overeating. The general rule or the rule of thumb is at least the meal time should last for 15 to 30 minutes because that's the time na nafe-feel na natin na busog na tayo. But sometimes, admittedly, this may be hard for others because we sometimes just squeeze our meal time in our daily chores, so it might be a hard practice as well. But if you may find time to adjust your meal time from 15 to 30 minutes, that may also be helpful. The third step in eating in moderation is to control emotional eating, because some of us turn to food whenever we're feeling sad, or whenever we're feeling lonely, or whenever when we are feeling boredom. But if you may find time to develop another hobby to para lang malibang yung attention natin, so we do not turn into foods whenever we're feeling those emotions. Next step towards a nutritious meal plan is to eat a balanced diet. So, a balanced diet gives your body the nutrients that it needs to function correctly. And to get the most of what we need, our daily requirement or our daily caloric requirement should come from the following macronutrients, such as carbohydrates, protein, and fat, and of course, water. So in terms of carbohydrates, we should focus more on the whole grains, on the wheat breads, less polished rice, and pastas as well. For the protein or meat consumption, it should be coming from should be limited to lean meat and medium fat meat, and lesser on those high fat meats. And the fat allowance should come from the unsaturated fat rather than the saturated fat sources. And to give you a guide in formulating meal plan, but of course, all meal plans should be highly individualized. It is based on our body's needs. But to give you an idea on how to make a meal plan using the tool that was made by Department of Science and Technology, Food and Nutrition Research Institute, they've released the food exchange list, which is a guide in making a meal plan. As an example, all of these food groups gives us a serving or is equivalent to one serving. Let's go now with the carbohydrates, which is the main energy source or the immediate source of energy of our body. So a serving of carbohydrates, for example, rice or bread or pastas, gives us 100 calories. That's equivalent to a slice of bread, 2 pieces of pandesal, half a cup of rice, and a cup of pasta. Also, root crops such as kamote and cassava are included as or are considered as carbohydrates. 3 pieces of crackers, which is almost 1 pack of crackers na rin. And then suman, popcorn as well can also be or is also considered as a carbohydrate. So 1 cup of popcorn is equivalent to 1 serving of rice, which gives 100 calories. But remember that all types of grains are good sources of carbohydrates, but there are some carbohydrate sources that are more rich in vitamins, in minerals, in fiber as well. Next food group is the lean meat, which is one of our sources of vitamin B12, iron, iodine, essential fatty acids as well. So one group of meat is the lean meat. So as what the term says, the lean meat focuses on the types of meat that doesn't have any visible fat. So included doon yung much buck size of any lean meat. That could be chicken, that could be pork, beef, fishes as well are considered as lean meat. It gives us 41 calories per serving. Also, a cup of cooked legumes such as munggo. This one is a good example. It also is high in vitamin B12, a good replacement if you would want to have a vegetarian diet. Shellfishes, seafoods like fish, and then crustaceans as well. And then another source of protein are the medium fat meat, which gives 86 calories per serving. That's equivalent to a piece of egg, 9 pieces of quail eggs, and then legumes na rin, such as garbanzos, canned fishes such as tuna, salmon. Those are good sources of omega-3 fatty acids, which is, by the way, an essential fatty acid as well. Tokwa and tofu, which comes from vegetable sources. Cheeses such as hard cheeses, cheddar cheese, feta cheese. Ayan, mga good sources of medium fat meat, which should be controlled or which should be consumed in moderation na rin, since it already contains 6 grams of fat per serving. And then the third source of protein is the high fat meat. So as what the term says, this type of meat contains more fat than the low fat meat and the medium fat meat. So it should be consumed rarely. Kung malilimit natin into 1 serving per week, that would be better. So the sources of high fat meat are the following. For example, luncheon meat, a handful of some of nuts but not all, balut and penoy, frozen meat products such as salami, hot dog, hamburger, what else? Longanisa and tocino. So those are the sources, or an example of high fat meats, which also, by the way, contains a lot of sodium, since these foods are frozen meat products. Therefore, they need a lot of sodium para magkaroon sila ng longer shelf life. So again, eat everything in moderation, especially this one, the high fat meat. It contains a lot of sodium and fat. Next one, or next food group, is the vegetables, which, by the way, just gives us 16 calories per serving. So ang isang serving nito is as many as half a calories na. So despite eating 1 to 2 cups or 2 to 3 cups of vegetables per day, it doesn't matter that much kasi 16 calories lang siya per serving. So imagine if you are on a calorie restricted diet, or if you are on a weight reducing diet, this one is a good source of calories, no? Despite being low in calories, vegetable contains a lot of essential vitamins, minerals, antioxidants as well. Also, an example is resveratrol, which lowers lipids. Also, another source of vitamins, minerals, and antioxidants are the fruits. So a serving of fruit gives 40 calories. That's equivalent to a slice of watermelon this big, yung parang triangle. And then 1 slice of mango, a piece of banana, 1 piece of apple, but not too big, not too big. What else? But buko water. By the way, buko water and buko meat are being measured separately. So a serving of buko water is approximately 1 cup. A serving of buko meat is half a cup only. Okay, so hindi siya pwedeng kainin ng sabay, lalo na kung restricted yung fruit intake mo per day. So, bakit nagkakaroon ng fruit restriction? Because naturally, fruit contains a lot of sugar. So, if your sugar is bordering high, it is better to ask your doctor or to ask your dietitian kung gaano karami ba yung allowance mo ng carbohydrates, because these also are sources of carbohydrates. Next food group is the milk, which is divided into 3 groups, which is the whole milk, low-fat milk, and the skimmed milk. Now, if your cholesterol or triglyceride levels are raising one by one, then you have to start consuming the low-fat milk and the skimmed milk instead of the whole milk, because these two contains or does have reduced fat content na. So, but if you're not into drinking milk, yogurt can also be a good replacement because it also contains calcium, a good bacteria as well that helps you have a good digestion. So, a serving of milk is equivalent to 1 glass of non-fat milk, or 4 tablespoons if it is in powder form. Again, consume your milk. There's no age limit in drinking milk. lalo na kung tumatanda na tayo, wala namang age limit yan. All the more na kailangan nating uminom ng milk for its calcium and vitamin D content. Okay, let's go now with the last food group, which is the fat. But remember that there are two forms of fat, which is saturated and the unsaturated fat. But actually, fat in general, kahit na naka-low fat diet tayo or low cholesterol diet, it doesn't mean na kailangan nating i-remove yung fat sa ating diet because there are fat-soluble vitamins. So when we say fat-soluble vitamins, it needs fat to be absorbed or to be utilized by the body. So an example of fat-soluble vitamins are vitamin A, vitamin D, vitamin E as well. So lahat ng yan ay fat-soluble vitamins. It needs fat to be absorbed. But remember, rule number 1, eat everything in moderation, especially these saturated fat because these are the fats that raises your bad cholesterol or yung tinatawag na LDL. So what are the examples of saturated fats? One is, by the way, it gives 45 calories. So an example of a serving of fat is a strip of bacon, 1 tablespoon of butter, chicharon, this one is cream cheese, and then mayonnaise also, and then gata, no? Yung pinapangluto or yung sinasama natin doon sa niluluto natin. So 1 tablespoon of gata or coconut cream is already 1 serving. So it contains a lot of saturated fat. Imagine na lang, no, when we're cooking, especially when we're using gata, rarely do we use just a tablespoon of gata kasi madalas mas creamy or mas masarap ang pagkain kung mas maraming gata yung nilalagay natin kasi mas creamy siya. But remember that it contains a lot of saturated fat. So babalik ulit tayo doon sa rule number 1. Eat everything in moderation. Okay? So when we're, if you really want to reduce your risk of having heart disease, it is best to reduce, of course, it is still best to reduce your overall fat intake and swap the saturated fat for the unsaturated fat. So as you can see, both gives 45 calories, but in terms of its content, doon lang sila nagkakatalo. What are the sources of unsaturated fats? Number 1 is roasted nuts or nuts such as almond nuts, cashew, macadamia nuts. Those are all good sources of monounsaturated fat. Another source of monounsaturated fat, which by the way lowers your LDL and increases your HDL or yung good cholesterol, is avocado. But some of us eats avocado with milk, no? Nilalagyan pa natin ng sugar. So as much as possible, limit on those food practices or limit those food choices. It is better to eat avocado as it is. Parang spread lang dun sa sandwich and then that's it. And then another source of unsaturated fat, or a polyunsaturated fat, are the vegetable oils such as canola oil, olive oil, sunflower oil. Yan. Ito yung mga good choices of milk if you're using coconut oil or palm oil. Better to replace those with vegetable oils, canola oil. Okay? So those are the examples or those are the contents of the food exchange list. It can be a good guide for making a nutritious meal plan, but remember always to consult a dietitian regarding this. Number 3, our third step towards a nutritious meal plan is to eat a variety of foods. So how do we consider that we are eating a variety of foods? By making sure that all of the 5 major food groups are included in our meal or in our plate. Okay? So in doing so, we'll be assured that what we're getting is a variety of nutrients as well. Also, another bonus ng pagkain ng variety of foods is that you don't get bored with your diet. So most of patients or most of people who are on a calorie-restricted diet, their common mistakes are consuming same type of food almost every day. So nandiyan yung egg lang every day or boiled saba lang yung source ng starch every day. Please do not practice that one kasi doon nagkakaroon ng mga macronutrient and micronutrient deficiency kasi same ng same yung nutrient na nakukuha per day. So the 5 major food groups that should be included in your diet are the following. Of course, vegetables and fruits, lean meat, poultry, fish, eggs, tofu, and nuts for your protein and amino acids, and then whole grains and cereals as your body's immediate source of energy, and then milk and dairy for calcium and vitamin D. So as an example, the USDA or US Department of Agriculture released the My Plate, which is a good guide to ensure that what we're having every meal is a complete meal. So the 5 food groups, including fruits, grains, vegetables, protein, and dairy, are in the My Plate. So note that bigger servings should be allotted for the vegetables, as they contain more vitamins, more minerals, fiber that makes us full easily, antioxidants as well for smooth metabolism, and then of course focus more on whole grains as they contain more fiber. So this is an example, or this is the USDA released My Plate. But it also has a counterpart dito sa Philippines, which was released by the Department of Science and Technology Food and Nutrition Research Institute. This one is called the Pinggang Pinoy. It is an easy-to-understand food guide that uses a familiar food plate to convey the right food group proportions on a per-meal basis to meet the body's energy and nutrient needs of adults. But remember that the Pinggang Pinoy has its different versions now per age group. No? An example of those is a Pinggang Pinoy for kids ages 3 to 12, for teens 13 to 18, for adults 19 to 59 years old, for elderly or geriatric patients for 60 years old and above, and of course for pregnant and lactating women. So, yan, different versions na siya. Bakit siya nagkaroon ng different versions per age group? Kasi, general lang naman, hindi pare-pareho or pantay-pantay yung ating requirement per age group. So, it should be highly individualized. Again, don't hesitate to consult a doctor or a dietitian regarding diet. So, as an example, this one is a meal plan that contains 2,000 calories per day and also a sodium level less than 2,000 milligram, because that is the recommendation of the American Heart Association for patients who were diagnosed with hypertension. No? So, ang maximum limitation ng kanilang sodium is up to 2,000 milligrams only. So, as an example, for breakfast, you may have a sunny side up egg as your protein, and then pan americano for your rice or starch, and then you have grapes for dessert. You may also drink powdered milk as your beverage, and then of course you have your olive oil for the preparation or for the cooking of your protein. And then for your AM snack, 2 to 3 hours after your breakfast, that is the recommended. No? Magkaroon tayo ng, of course, rule number 1, consider small portions. Consider small frequent feedings para hindi tayo, ang tendency is hindi tayo nag-overfeed or overeat for one meal only. Okay, and then for AM snack, you may have 3 pieces of pandesal, mayonnaise, a teaspoon of mayonnaise, and a chicken flakes on it para chicken sandwich, and then fresh cow's milk again for your milk, and then you have sugar. For your lunch, that would be chicken walnut, a slice of chicken walnut with snow peas and mushroom as your vegetable, a cup of rice for your carbohydrates, and then of course apple for your dessert. And then for PM snack or for your afternoon snack, you may have a piece of small saba. By the way, saba also is considered as root crops, or rather a starch. Therefore, it is a carbohydrate. For the beverage, you may have apple juice or unsweetened if your sugar is getting high. But if hindi naman, you may have sweetened apple juice. And then lastly, for dinner, as your last meal, you may have sinigang na bangus as your main dish, and then 1/4 cup of labanus and kangkong with rice and mango for your dessert. So that is an example of 2,000 calories. By the way, which is the need of an average person. But of course, it depends on the age, it depends on the sex, and the physical activity level. Males tend to need more calories than female, and of course, people who does exercise regularly needs more calories than person who does not. Also, another ways for health to achieve a healthy and nutritious meal plan is to identify and reduce the sources of sodium and fat in the diet. But of course, to reduce, we have to identify first what are the sources. So the following are the sources of sodium and fat. So you have the frozen meat products such as hot dogs, longganisa, tocino. Of course, you have the salted egg, condiments and additives, and yung mga nilalagay natin sa pagkain na pampalasa. As much as possible, shy away from those. Use salt instead and then pinch lamang ng salt. Then you may also add herbs and spices para dagdag aroma na rin. No? So dagdag na rin doon sa panlasa. Then, of course, cheeses. So you have to eat, again, everything in moderation. So once we're able to identify the sources of sodium and fat in the diet, it is better na rin to reduce. So one way to, or one tip to reduce the sodium and fat intake in the diet is to replace traditional higher sodium foods with modified versions such as low sodium, reduced sodium, or lower sodium, or for this part it is with less salt. So this could also be helpful yung may mga claims na ganito. Another tip for reducing sodium and fat intake is to remove or decrease salt from recipes whenever possible. So as what I've said, pinch lang, and then you may add herbs and spices na rin as a replacement. Another tip is to rinse canned foods before cooking to help reduce sodium content. So yung paghuhugas natin ng maigi, it also reduces the sodium content of the food. Lalo na yung mga canned food because they contains a lot of sodium para na rin sa longer shelf life nila. And when we're eating out, request that salt not be added and ask for sauces and salad dressings on the side. So, hindi mo na ipapadagdag or itatop pa doon sa pagkain so that you can control the amount that you use. And then lastly, last tip for reducing sodium and fat intake is to replace saturated fats with the unsaturated oil. So, in summary, to achieve a healthy meal plan, remember these 3 AC principles, which is to eat a balanced diet by including the 5 major food groups. Next step is to eat everything but in moderation by controlling your portion and taking your time. Then lastly is to eat a wide variety of food to ensure that you're getting variety of nutrients as well. And how do you do that? By planning your meals ahead of time. So those are the steps to achieve a healthy and nutritious meal plan. So remember that at first they'll be asking you why you're doing it, but later on they'll ask you how you did it. These are my references. And then for personalized holistic nutrition and weight management, don't hesitate to contact us at Center for Weight Intervention and Nutrition Services, 6th floor North Wing main building of St. Luke's Medical Center, Global City. And these are our local numbers and mobile number as well. Thank you again and good day, everyone.
Thank you, Miss Cassandra Serio. Again, that is our second session. We still have one more. We would like to remind all of our participants here in Zoom and on YouTube that you can type your questions in the chat box and they will be addressed by our speakers at the end of our next lecture. That will be followed by a question and answer portion. All right. Now it's time to proceed to our next session. Please welcome Dr. Frederick Cheng.
Hello, everyone. In today's era of evidence-based medicine, there's still a lot who does not practice evidence-based medicine. Instead, they do believe in anecdotal evidences or hearsay from their friends and neighbors. Probably you have heard from radios or social media enticing the public to try out certain products, herbal supplements, and claim it will be able to treat 50 different kinds of diseases. It is natural, no side effects, and fights all kinds of diseases from hypertension, diabetes, stroke, myocardial infarction, all kinds of cancer, etc. And of course, we know that this is not true. So I tried to look for our drug reference, which is the physician's desk reference and the memes for guidance. But unfortunately, I was not able to find a drug that can miraculously treat 50 conditions. But what if I tell you that there is such a medicine, in fact, that is what I will discuss with you, that will help address all these 50 conditions. But first of all, I'd like to thank the Women's Heart Health Unit for this invitation to speak in this lay fora. And I'm requested to talk to you on the benefits as well as the risks of physical activities and what do we call an effective exercise. Okay? And during the course of my talk, I will be using the words physical activity and exercise interchangeably, and will be highlighting the many benefits of physical activities as compared to their very, very small risks. So when we try to define medicine, it's actually a substance or preparation used for the treatment or prevention of disease, something that will affect well-being. It can also be the science and art of dealing with the maintenance of health, as well as prevention, alleviation, or cure of disease or injury. And as I mentioned earlier, I will tell you that there's one such medicine, and that medicine is called exercise. Well, strictly speaking, exercise did not fit the definition of being a medicine because it is not a substance, but it is used for the treatment and prevention of many diseases. And I will make a strong statement and justify in my talk that exercise is really a medicine that has conferred many proven health benefits. Therefore, physicians should be able to prescribe that in every patient. And that would find a way to make sure that all their patients would be able to subscribe to that exercise regimen. If exercise is a tablet, we physicians probably would recommend it this way. Well, a few tablets would definitely be better than none. More tablets may even be better. And make sure that you take them in most days. And make sure that you also try not to miss a lot of days in a row. Well, there's a global epidemic of inactivity. Well, what I'm showing you in this slide is based on the World Health Organization data. Listed are some of the 19 leading risk factors contributing to death globally. Okay? And physical inactivity actually ranked number 4. Therefore, we have the other global pandemic of inactivity that is now happening even before this COVID pandemic. This is also data taken from the United States. As we look at the 15 leading causes of death in the United States, what I have highlighted are the ones in red and yellow. Why? Why did I highlight all of them? Because these are all physical inactivity related diseases. So from heart conditions, from cancer, from stroke, diabetes, even Alzheimer's disease and Parkinson's disease have been linked to physical inactivity. Well, I know this is a very busy slide, but I'd like to summarize it by saying that with regular physical activity, we will be able to reduce all-cause mortality by 30%, cardiovascular heart conditions by 35%, diabetes by 40%, cancer by 30%, breast cancer by 20%, dementia, depression 30%, and even fractures by 8%. So again, you remember the first slide I showed you that is there any medicine or any herbal supplement that will be able to achieve all these irrefutable benefits? I hope I was able to convince you now. Yeah. I'd like to show you this curve showing the dose response curve. What do we mean by that? We mean the dose response curve is that those who are sedentary, that means their baseline activity level is very low. Actually, these are the people who would benefit the most with increasing their physical activity. Now, if you're already very active and you want to further increase your physical activity, then the amount of benefit would be still present, but a bit smaller as compared to those who are sedentary. Okay. Now, 7 decades ago, and there were already a couple of landmark studies. This is actually taken by done by Morris, and probably this was done as early as 1950s. Okay, so what they the study actually conducted included comparing those are conductors, okay, versus drivers, and they would like to measure the incidence of heart conditions. Well, what it showed, okay, on the left side, the annual rate of heart disease conditions was significantly lower in the conductors. Why? Because the conductors in the buses usually would have to go back and front to the back of the bus, and of course they're standing. As compared to the bus drivers, they're seated for the whole duration of their work. I know there were issues in terms of what we call the J-curve phenomena, meaning to say that with no physical activity or low physical activity, the heart condition or heart disease risk is very high. And then as you increase the physical activity, you lower down your risk. But with intensive or very high intensity physical activity, there's an apparent increase, but there's a small increased risk. But the bottom line here is that with physical activity, particularly with moderate physical activity, definitely that would translate to reduction of cardiovascular disease risk. Okay, I'm showing this slide to help us compare which one is better, low physical activity, moderate, or high physical activity. And just to summarize this slide, it just tells us that moderate and high physical activity were associated with lower mortality. And the greatest benefit were seen when comparing those with high physical activity versus with low physical activity. There's a dramatic difference as far as all-cause mortality or the incidence of heart conditions. Now, this is also a relatively old study, but this is very interesting. So what they did is they followed up these patients. There were almost 10,000 patients between 20 to 82 years old. And they followed up these patients with an interval of about 5 years. Okay, So on the leftmost bar, okay, these are patients who started with being unfit, and at the end of 5 years, they remain unfit. And if you look at the incidence of risk for death, definitely it's going to be high. In comparison to those who became fit, that means unfit and then they became fit. Okay? You can see the risk for all-cause mortality and cardiovascular mortality was reduced. Okay? And interestingly, in the third column, these are patients who were fit, but later on became less fit. No? But you can still see the advantage or the benefits that they acquired when they were still fit. No? And that's the reason why in this column, their risk for death and cardiovascular mortality was still manageable and low. Right? And of course, the best group of patients were those who were fit, and then 5 years later, they still remained fit. In fact, there was further reduction of mortality. Well, unfortunately, we do have this scenario that we are facing. And this is the reality of sedentarism. And it refers to most of the activities commonly associated with sitting, lying down, sleeping, and various actions that are performed in a state of low energy expenditure, and as shown in this slide. And what we are will be discussing would be the different types of exercise. Now we have exercises such as high intensity interval training, low intensity interval training, or continuous, sort of like an aerobic type of exercise. No? So for example, in high intensity interval training, these are relatively short in duration, but in terms of intensity, it's high. And time efficient, because usually it will just be 4 minutes, 5 minutes, or even just 10 minutes duration. No. For low intensity interval training, it's moderate intensity with short breaks, moderate length needed. That means probably about 30 minutes to 1 hour. For continuous, it's one long bout, no breaks, and intensity is relatively low, and you have to perform the exercise for relatively long time. Okay, so let's now differentiate, no? Moderate intensity versus high intensity. I'm sorry, MICT, which is moderate intensity continuous training, versus high intensity interval training. What we commonly know would be the MICT. This is the traditional exercise that is being recommended, which is to ask the patients to exercise between 30 minutes to 1 hour, and then you you try to achieve the heart rate response between 55 to 70% of your heart rate maximum, and the oxygen consumption would be at that level, 40 to 59%. In contrast to high intensity interval training, the intensity would go as high as 80 to 100% of your peak heart rate or your aerobic capacity. Okay, and you do bursts of activities between 60 to 240 seconds. So that's the difference, no? Okay, and I'll show you which one is better. Again, the guidelines traditionally would recommend MICT. Ask you to do treadmill, ask you to do cycling, to do brisk walking, to do swimming, dancing, and so on. That's the traditional exercise. Okay. Now, what I'm showing here is that in patients who are obese, okay, so we would like to know whether high intensity training, will it be better than the traditional aerobic type of exercise? Okay. And it showed here, as far as improvement of cardiorespiratory fitness, apparently this would be in favor of high intensity interval training. Likewise, in terms of achieving weight loss or in terms of reduction of body fat, and again, you can see that the point estimate here is to the left, meaning to say it was in favor of high intensity training. Okay, so high intensity training would be better in terms of improving endurance and in terms of achieving weight loss. So another question I'd like to pose is, which one is better? Can I do multiple short duration exercises, or should I just do one long duration exercise? And I saw this particular study, which I think very applicable in today's setting. No? And this is a study wherein they included 3 groups of participants. Okay, the first group, what they did is they were asked to sit for 14 hours. Okay, probably most of us are doing that right now. No? So we're in a Zoom meeting, we're doing our work, no? Or studying for the students in front of the computer as much as 14 hours per day. Okay, the second group is that out of that 14 hours, okay, they remove 1 hour and ask the participants to do about 1 hour of moderate to vigorous cycling. Okay, so just like we said, the moderate intensity continuous training. Okay, the third group is that out of that 14 hours, okay, you remove about 4.7 hours, so almost 5 hours, and that 5 hours was distributed into 2.5 hours of standing, just plain standing, okay, and then another 2 hours of light intensity walking. Okay, so trying to we're able to picture what were the activities being done. No? So one is just sitting, the second is 1 hour of exercise. The third group is there's 2.5 hours of standing and another 2 hours of light intensity walking. Okay, and what it showed, okay, it showed that of course the worst would be those who are sitting for more than 14 hours. And by the way, the parameters that they used were some blood tests, no? In terms of the levels of the sugar, levels of insulin, and how it will help reduce, no, the levels of glucose reduction. Okay, and actually, between exercising for 1 hour versus those who were sitting less by standing, by doing some walking, interestingly, it was the group that were sitting less actually had the best parameters as far as their blood tests are concerned. Okay, so I know a lot of people would say, but I don't have time to exercise for half an hour, and I don't want to do that. Okay, especially nowadays, the gyms are closed, and they're not allowed to exercise outdoors. No, so what can a patient do inside their house? Okay, and probably a very straightforward answer that I will give them is that any exercise, something that you can do, is always better than nothing. Okay, so let's talk about the practical aspect. No? So what are some of the things that we can ask our patients do, no, inside their house? No? I think we do have a lot of options for our patients. No? So if they do have weights like kettlebells or free weights, they can use that. Okay, there are medicine balls. If they can afford those expensive equipments, then so much the better. Okay, but one of my favorite exercise equipment is on the third column. This is the resistance band. Okay, it's relatively portable, it's safe, no maintenance required, and you'll be able to achieve both aerobic as well as resistance training once you do resistance band exercises. Okay, so you can do, for example, bicep curls, you can do like a chest expansion, and you can all build up muscles the same degree as when you do perform free weight training. Okay. Now, if you don't want to use any equipment, you can also use your body weight. Okay, and I'll show you here. No, so this is like an example of 4-minute workout. Now, probably at the end of this lay fora, you'll be taught on. I think there's a 5-minute workout that you can perform on a daily basis. No, so an example will be you can do squats. Okay, or you can do that's what they call mountain climbers. Okay. You can do push-ups. For those who cannot perform push-ups on the floor, you can push against a table or against the wall. Okay. You can do lunges, or you can also do some jumping jacks and a variation of all these exercises. So these are examples of like a body weight exercises without using any equipment. And you can achieve the following benefits, no? Because the training idea of high intensity interval training would be to build up not only the aerobic capacity of your body, but also to improve on strength. Okay, so for example, I mentioned about the 4-minute exercise. So what we can do is that we do 20 seconds of a certain exercise. Okay, do as much as you can within that 20 seconds, and then rest for 10 seconds. So that's about 30 seconds. And then you do another exercise for 20 seconds, rest for 10 seconds. So that's about eight rounds. So all in all, that's only 4 minutes. Okay, and here listed are some of the exercises that you can do. No? For example, for cardio exercises like burpees, jumping jacks, squats, high knees, jumping lunges, jumping rope. No? For strength, you can do push-ups, pull-ups, sit-ups, and so on. So it's actually a combination of all these exercises to build up your cardio and muscle. I'd like to pose another question. No? Are we able to reduce our waistline? Will we be able to reduce the amount of fat in the body and improve on blood parameters like insulin in response to exercise with weight loss? Let's say more than 5% weight loss. And easily, of course, the answer is yes. Will we be able to achieve the same thing in response to exercise with no change in weight? Well, meaning to say, you measure yourself, your weight is still the same, but you're now exercising. But why is it that the weight remains the same? And I'd like to show you some of the evidences, no, to show that in those individuals who performed aerobic exercise in 4 months, and then they check whether did they achieve weight loss or not. Okay, the control arm is on the left. Okay, the leftmost. Okay, and of course, nothing happened. Their waist circumference did not change. In fact, in the group of obese women, in fact, it did increase. For those who achieve more than 5% weight loss, of course, you can see the significant reduction in their waist circumference or their waistline. Okay, but I'd like to highlight on the third group of patients. No, this is in the green bar, wherein they were able to exercise. Okay, there was no weight loss; their weights are the same, but in terms of the waist circumference, there was reduction. Okay, so of course the clear winner are those patients who achieve more than 5% weight loss. But I know there are some individuals who get frustrated that they're now exercising and the change in their weight was not significant. But we can reassure them by saying that weight is not the only parameter, because it has been demonstrated that as long as you exercise, you will be able to reduce the amount of fat in the body. You're able to reduce your waistline. You increase your muscle. You increase your cardiorespiratory fitness. And of course, you improve on your sugar levels. And that's the reason why there's a concept of fitness versus fatness. Okay. And I'd like to show you this. I know, again, this is a very busy slide, but the one on the left, the topmost, upper left would be overweight but unfit. The one below would be overweight and fit. The one on the right upper would be obese, unfit, and the one below here would be obese and fit. Okay, so if the points or lines are to the right, that means there's higher mortality, more events. Okay, so let's look at overweight, unfit, and then overweight, fit. So as you look at in those individuals who were overweight and became fit, you can see that their risk for dying becomes lower. In the obese group of patients, the same thing. If they remain unfit, their risk for dying is very high as compared to those who are obese but who are exercising. Their risk for dying would definitely be lower. Okay? Maybe I may sound like a broken record by this time, saying that we all should increase physical activities. Yeah? This exercise is actually a medicine that has been shown to be beneficial, not only for the heart, but also for the brain, but for your muscles, and so on and so forth. That's why I said this exercise as a medicine can treat more than 50 kinds of conditions. And I'd like to end my talk by giving you the salient points of what we have discussed. Okay, so first and foremost, exercise would be your best medicine available. It's cheap. In fact, it can be no cost at all. Okay, some exercise will be better than doing nothing. And therefore, we also ask all of you, even our patients, go break your sitting. Okay, so that's the reason why right now I'm standing doing this presentation. And then most of the time when I attend meetings, I would be standing up, in front of the computer. Okay. Number 3, we discuss on should we do the traditional exercise that is being recommended, which is to do aerobic exercise or moderate intensity continuous training. Or I have proposed that you may consider doing high intensity interval training. From a practical standpoint, probably the duration would be shorter, and probably the benefit would in fact be greater. It's never too late for us to start now. So I hope after this presentation, you will now begin to do sitting breaks. You're now able to walk within your subdivision more often and do certain kinds of physical activity. And lastly, I highlighted that while it's true that we want to maintain our ideal body weight, we want to maintain our ideal body mass index, but the mere fact that you're able to improve on your physical activities, or what we call fitness, that's even a better indicator than fatness. Okay, And I did mention with or without weight loss. So don't get frustrated if people don't get significant weight loss. But as long as they carry out certain physical activities, then they would already derive the advantages of exercising. Okay, so with that, I think this is the best time to start and just do any form of physical activity. Thank you.
Thank you very much to all our wonderful speakers. And of course, we now proceed to our question and answer portion. And with that, we would like to welcome back our moderator, Dr. Erlene C. Demere.
Thank you. Thank you very much. I'm sure all the participants would agree with me. We really had 3 good, very, very good lectures. And I hope you have questions in your mind. Feel free to just type your questions on the chat box and we'll try as much as we could to answer them. I would like to thank Dr. Helen Ong Garcia, Ms. Serio, and Dr. Fed Cheng for a very well prepared and very simple yet direct to the point questions. So now they're on the Zoom panel with me. Welcome, Dr. Fed, Ms. Cass, and Dr. Helen. Okay, welcome. Now, our speakers have shared with all of us important points to remember as we, address this unequal burden of heart disease in high-risk communities like women. This is really what this is all about, right? It's awareness of women's heart health, whether we embrace the stages in our life, as Dr. Helen said, from youth to not so young into the menopausal stage. And as Cass showed us, diet is important. Now, Cass, you have to accept now all of probably the listeners here are like, what will we eat and all that, but we will get questions from them. And of course, from Dr. Fed, how can we do all of these things all together? But I guess listening to all of you, it's really a balance between diet, exercise, and embracing our stages in life, correct? Right? As long as you eat right, logically eat right, as long as you move, as Dr. Fed said, you just have to move and the evidences are there, okay? So maybe in a nutshell, it just means that we have to understand that symptoms can differ between men and women. That's why we are holding this Women's Heart Health Forum, right? That women, as you take care of your heart health, you should consider that symptoms can differ, although chest pain still is number 1. And know your risk. Know your risk, as Dr. Helen has always been emphasizing. Know your risk. Don't wait for menopause to know your risk. Accept your age, your hormones, and embrace your health. But be proactive in prevention. That's why let's see if we have questions for these people here. Maybe let's start with Dr. Helen. Thank you for walking us through the stages in life from premenopause to menopause and how we could probably reduce our risk of heart disease. Okay, because we know menopause is really one disproportionate factor for heart disease in women. Men have andropause. I don't know who among you can comment on that, Fed or what. But we know that once you reach the age of 50, I'm sure malapit na tayo dun, Helen, reach the age of 50. About the age of natural menopause, right? But we know that it increases dramatically after that. But I guess the point here is to take hold of our heart health even before we reach that stage. Kasi pag bata pa daw, like Cass, the main concern is what? Breast cancer. It's cancer, right? And then asa ka na yung heart disease pag tumanda na ako. But I hope the viewers will understand that we are trying to do this to create awareness that heart disease can hit any age, especially in women, right? So, my dear Helen, okay, knowing that women are more likely to have high blood pressure, risk factors probably more than men. I don't know what the factors are, but we still ignore that. What do you think is the reason that women kind of not give much attention to heart health?
I would believe, thank you for that question, Erlene. But you're right, there are different presentations of women and men with regards to heart disease particularly. I think you're right. The awareness of cancer and it's tragic and so much highlighted in media, in whether paper or even in video. At the same time, it's dreadful. We're not downplaying the effect of cancer. It's just that the fact that cardiovascular disease is put on the side because every time there's a lecture that they hear, they would say that men are more prone than women to develop heart disease. Number one. Number two, the multitasking or the multiplicity of roles that women have. Women normally have this innate traditional role of taking care of the family. If the men are the breadwinner of the family, the women are the bread makers of the family. So which means because of this priority tasking that they have in terms of taking care of the family and knowing that men are more prone to that, and I would probably say this for all women, we tend to prioritize our men. At the time that we get married to them, we tend to have them check up more than we do. At the same time, there's this denial and this security blanket we have that hindi ako tatamaan kasi they're more prone. So both love, fear, and also probably the lack of such fora to address women to say that, hey, you're also vulnerable, makes that an attitude among women. Na una muna ang loved one ko before me. And by the time it hits me, not realizing we're both of the same age. So I guess that's one of the reasons why women tend to think that it's not a priority. But cancer hits anyone. That's why they are more aware of having themselves. I think I would congratulate all women. Why do we have ourselves checked for cancer? I think it's not because we're afraid or fear for our life per se, but it's because we are fearful that we might leave the people we're taking care of. That's why na-prioritize siya, because we know the fact that you address cancer early, we continue with the multiplicity of roles we have. So kudos to women because we're the heroes of the family. The four walls will not live without women, and Fed do not contradict, or else when you get home, you will not be able to have a good meal. So I guess that's why.
Yeah, I agree fully with Helen, and of course we know that even when exercise is the topic, women, even not regardless of age, women are really less into exercise than men. Tama ba yun, Fed? Is that in your experience, are your women patient more difficult to encourage to exercise than your men, the men in your patient group?
Well, probably, first of all, I'd like to mention that I'm not in the stage of andropause yet. As seen by my receding hairline, probably I still have enough testosterone available.
Okay, wow.
But, well, probably some of the things that I would encounter. So the response I get from women is that I do a lot of household chores already. And can that be sort of like a replacement for exercise? So I'm okay already. I usually clean the floor, clean the windows, and so on. So, but my answer to that, yes, I did say that a little is better than nothing. Okay. However, what we want really is to achieve certain levels of, for example, you want to achieve certain levels of achieving a target heart rate. Sometimes you do. Just sweeping the floor, I mean, the heart rate will not go that high. So, but I still would recommend that they have a certain physical activities that would raise up their heart, and at the same time, certain activities that will help build up their muscles. Okay, so it's a combination of aerobic and trying to build up their muscles. So sometimes you're doing household chores. I would say it's very, very low intensity. So I still would like them to do a more regimented certain activities. And I did highlight like activities like if you do squats, lunges, push-ups, sit-ups, or jumping jacks for that, that would really achieve the additional benefit. But to answer your question, the excuse I usually get is that I am already doing a lot of household chores. I think that's enough. So probably I would say a little more would be better.
Yeah, and I think Helen will agree to that household chores are not really the measure of activity, but at least they're not the couch potatoes like some of husbands might be. That's why they're more concerned with improving the healthy lifestyle of husbands, right? Well, I don't know, but I hope I have questions from the group. But it's so interesting putting the three of you together, because we know that it's not all about exercise as well, right? It has to be also dietary. That's why I think the presence of Miss Cass Serio here is very relevant, but very challenging in a sense that, like exercise, sometimes it also like, okay, I will diet tomorrow, I will do this tomorrow, I will, but we know that you are what you eat, right? So sometimes, what are you eating? You start to say, who am I really? Am I eating the right food? And in our experience, my dear Cass, our patients also they just say, okay, I don't want to go to a dietitian anymore. I know you've encouraged that professional help will be good. They can go to a dietitian, look at the risk profile and all that. But some patients are really like, if I go to a dietitian, sometimes I don't really know what to eat anymore. So could you probably tell us just a quick guide for women to just think in their busy work day, not just to look into all that, food groups. And I like the way you said moderation, balance, and variety, mo bava, right?
Yes.
I think that's what we always tell our patients. Moderation, if it's really grossly sweet and grossly fatty, I think avoid. But over and over again, we have been telling our patients that diet is important. Okay, so maybe you can tell us, like, is there a change from youth to menopausal stage? How do we change our diet? How does this really affect our heart health? Because we know that women are more parang may food-related conflicts sila eh. Yung, syempre, they want to, be less fat. It's all about the body at times. They forget that it's the internal that we're trying to change, right? But we can take that out. Even when they exercise, some men would want to exercise because they really feel the satisfaction of exercise. Some women, they exercise because they want to have better bodies. But we want to now, for this platform, really tell our viewers that it is the overall health that we're looking at, right? So, my dear Cass, I'm sure maraming women dito na nakikinig na they cannot balance creating a healthy plate for their children or for themselves. Just a quick guide that you can give them para they can bring home from all that you have said.
Yes, Doc. Actually, most of our patients, especially here in weight intervention and nutrition services, they usually come here once na nagmamanifest na doon sa kanilang blood chemistry values, yung effect sa kanila ng kanilang diet, or once na nabibigatan na sila doon sa kanilang sarili. That's the time that they come here. But one thing I tell them is that the first good thing that you've done today is coming here at weight intervention or asking for a professional help, because acknowledgement, yun muna yung first na mangyayari. Right after, doon na po mangyayari yung changes doon sa kanilang diet. But one thing to follow is that they may actually follow the guidelines released by the National Nutrition Council, which is the 10 Kumain Meds. It is just a simple guide on how to maintain a good or a balanced diet. Pero yung unang point, yun po yung pinakamahalaga doon, which is to eat a variety of food every day. Because once na ma-ensure na natin na merong variety doon sa ating kinakain, ma-ensure natin na lahat ng nutrients na kakain natin or lahat ng essential nutrients na dapat nami-meet natin doon sa ating kinakain, nami-meet na natin through our diet. So there's no need for supplementation anymore, unless of course merong condition na nangyayari doon sa ating katawan mismo. But that's the first thing that you may do. Eat a variety of diet, and then, of course, monitor your weight every week. Not every day, because if you do it every day, minsan doon tayo mas nadi-discourage kung wala tayong makitang significant na changes. So you may do it every week, and then you may also track your caloric intake per week or per day rather. You may also track your caloric intake per day. But of course, wag nating isi-set aside yung macro and then micronutrient intake din natin. So the vitamins and minerals, they are also essential. So take or make track of it, or record your caloric intake as well. You may also ask a dietitian on how much calories do you really need in one day. Or you may do it you may do it yourself. For example, take record of your weight and then multiply it to 30, because that is the general caloric requirement per kilogram body weight for every women and men. Ganun din po yung pag-compute, no? So you may also try that thing then. But first things first, you have to you just have to have a balanced diet, a moderate diet, and a variety of nutrients every day.
Thank you, Cass. Yeah, a variety of nutrients. Yeah, I guess that's one thing that we should all grasp as well, that when we advise patients to eat the proper diet, we're also looking at the bottom line, which is oxidative stress. That's correct, right? There's too much eating or too little eating, or there's too much exercise or too little exercise, that goes down to what we call oxidative stress. And I guess that's the one you're trying to say, Cass, by taking in all the nutrients, nutritious food, vitamins and minerals to lower oxidative stress. And I guess we know, maybe Fed can also jump in, as if it's too little exercise, there's oxidative stress. That's why Fed is telling us to stand up. Are you standing up, guys, while talking? I'm sitting, but anyway, to stand up, to lessen our sitting time, to improve our exercise. I guess it's also a attempt to lower oxidative stress in our body that brings about all the maladies that we could imagine, right? It affects all multi-organ systems because of oxygen-free radicals. So I know that what you're saying, Cass, is for us to take in the proper diet, so we lower that. And Fed is saying that we exercise so that we lower that as well. But the question is, especially for Fed, is there too much exercise? Because we know that oxidative stress can also increase with too much exercise. And I think there's a question in the group that says, how do we know it's already too much for us?
Yeah, okay. Before I answer that question, I just would like to follow up what Cass said. And then also, I just noticed, I don't know whether it was just a coincidence, that all three of your speakers are all members of the weight management center. No, all three of us are active, and we do emphasize that. No, so it's a multi disciplinary team, no, in terms of addressing those people who would like to become active, not only from the dietary side, but also from advising them to increase their physical activity. And we're fortunate that St. Luke's do offer that, no, and that's not common in other institutions. No? Now, as far as diet is concerned, probably we need to highlight Mediterranean diet, because that's the only one that has been shown to reduce mortality. So for the audience that are listening, just search for Mediterranean diet. Try to pattern your diet according to the style of how the Mediterranean people eat. No, so it's not Cohen, it's not Atkins, it's not ketogenic, it's Mediterranean diet. Now, as far as exercise is concerned, yes, we need a little stress to stress the blood vessels, and that's what exercise can do. But your question relates to excessive exercise. Yes, we did see a sort of like a curve. No, when you say the curve, when I don't exercise, the risk for events very high. If I exercise, it goes down. But if I do it excessively, there's a slight increase. No? And that's the reason why the gist of my talk is that I'd like to discuss on the large benefits of exercise with a small risk of exercise. No, that's why we do have, for example, certain parameters. Like one is the target heart rate. We don't want your heart rate to be more than what is necessary. So usually we just achieve 70-85% of the target heart rate. You sustain that, although if you perform high intensity, you may go a little more, no? So more than 80% of the target heart rate. No? So that's one parameter, that whether you're doing excessively or not. Number two, what is your baseline physical activity? if I'm starting from scratch, then I don't expect me to exercise 1 hour immediately. So you can start with 10 minutes, then gradually increase the duration. You can gradually increase the intensity of the exercise. No? And then the third would be the orthopedic concerns. No? If you have a knee problem, hip problems, back problems, I mean, these are some of the concerns or some of the issues that I will discuss with my patient. No? And of course, cardiopulmonary clearance. Okay, so make sure that their heart is okay, their lungs are okay before they undertake certain exercises. No? So, but again, we need to highlight the benefits, the numerous benefits, and that's why I said this is the only quote unquote medicine that can cure 50 conditions. So I challenge anyone who can present me an herbal supplement or a medicine that can cure all these 50 conditions.
Erlene?
Yes, Helen.
Yeah, may I put in?
Sure, sure.
As mentioned by Fed, all of us work on the Weight Management Center, but the focus today is actually, well, Weight Management Center deals with 80% of our patients are women. I think that's right, Cass, right? 80% perhaps are women. For what? Primarily it's before parents. But I think one very practical thing that I could like to highlight to our audience now is the only one who can determine whether it's too much or too little for you is you. So which means when you go to your doctor and you ask for professional help to actually maintain a very fit condition during menopause, first and foremost, do an inside reflection. This is a negotiation. It's just like any business deal. Your doctors there are not your prisoners. They're there to negotiate, strategize, come up with a program that fits your daily living, which means that if you are actually a fish and rice person who's right beside the palengke and you prefer the Filipino food, talk to your dietitians. We can modify. We can modify that because what we're aiming for is sustainability. We're not aiming for a flash in the pan deal. The same way with exercise. Thank you, Fed. You just reiterated that what I'm doing now in my life at my home is actually those things that the lunges, the plank with the knee, whatever you call that, actually doing them. I just can't name them. But again, knowing yourself. Let me try to see it on a practical basis. I can do them except the lunges because I do recognize that my knees are not the same. Arlene, years of becoming dancing queen has already taken its toll. So which means you have to know yourself. If you go for professional, if you adapt exercise, adapt a diet for which you just adapted because somebody says so on video or somebody says so in clinic, you might not sustain it because if you feel pain, if you feel hunger, if you feel sadness. So negotiate. Be as aggressive as fighting for what you want. And we will do the same way in fighting your thoughts on why what you want is not right for you, but we'll do it in a nice way. So just some practical tips for our audience.
Yeah, thank you for that, Helen, because like, as we said, this is a women's heart health forum. And we know that there are really gender differences in perspective where it comes to diet and exercise, right? And health and lifestyle conditions as well, like mental stress, depression, right? Smoking in women, inactivity. So thank you for all your insights about that. We have some questions about how women should address their lifestyle as well as their diet. For example, when they start exercising, I think the three of you can just jump in to give insights. Is how do you prepare yourself for exercise? What do you eat before, after, during? You know, so that the multidisciplinary approach that you have been saying in the weight management would also apply to those who are listening to us now.
Okay, it's men's first na ngayon tayo kasi nag-iisa siya eh. Kawawa siya.
Men first.
Okay, so I think the bottom line there is, well, we want a balanced diet. No? So that's the reason why the nutritionist or the dietitian play a role. No? So we usually would compute, for example, what's the baseline weight of the individual and what would be the energy expenditure. And then we compute, no? based on the calories that the individual is expending, and at the same time what is being taken. No? So I think the dietitian will play a role in determining that. As far as before and after, of course, we just ask them to take a light meal. We don't want them to have a heavy meal prior to an exercise. But I think my short answer to that is a balanced diet. No? So in order to meet all the requirements, no? Because as I think I meant Dr. Helen Ong Garcia mentioned, if you're doing so much intermittent fasting, for example, and you do exercise and then you suddenly will collapse, and then the next time around you don't want to exercise anymore because you're afraid that you may collapse. No? So make sure that you're able to adjust your schedule based on your meal time and the gradual increase of your physical activities.
Yeah, okay. And later on, there's also a question about intermittent fasting that Fed already mentioned. Maybe they also want to hear from Cass about what do you advise protein loading, carbohydrate loading, these things that they do before, during, or after exercise. Cass.
Okay, so in addition to what Dr. Frederick Cheng have already said, so before exercise, kinakailangan po talaga na meron tayong kinain at least an hour before your exercise so that hindi tayo mahirapan or hindi tayo masyadong mabigatan sa sarili natin during exercise. And then after exercise or during exercise, we should be properly hydrated. Sometimes water is not enough, especially for those who have who does high intensity training during exercise. So they do drink energy drink, but we do not really recommend, especially those na mataas sa sugar. And then after exercise, you should eat something that is moderate in terms of carbohydrate, and then technically a high protein diet. That's after exercise, and then a moderate fat content diet na rin po. That's after exercise. But to measure how much is moderate, how much is high, or how much is low in terms of the macronutrient, we actually kino-compute po kasi siya depending na rin dun sa depending sa stature ng patient or depending on his height and his weight na rin po.
Okay, you proceed with probably commenting on intermittent fasting. There's a question in the chat box for that. Cass?
For a while lang po.
But if I may allow, I just would like to comment on the energy drinks. So I know it's very popular that people would take energy drinks mainly to replace the electrolytes. No? But we have to remember that certain energy drinks may contain certain caffeine. No, sometimes they would drink coffee, and then after that they drink energy drinks, and then after that they exercise. What's the effect of that? The caffeine, the coffee, the tea, and so on. Excessive caffeine may stimulate the sympathetic nervous system, and sometimes may predispose heart rate going up, and sometimes may cause irregular heartbeat. No? So make sure that when you take those energy drinks, make sure that you don't combine other drinks that may also have caffeine. No? So for example, you drank a soft drink with caffeine, you drank coffee with caffeine, and then you drank energy drinks with caffeine, and cumulatively there's an increased amount of caffeine, and that's sometimes may cause some problems during exercise. No? Just some caution. No?
Yeah, that's very good, Fed, because it's really popular now. No? Even protein shakes and all that, right? So thanks for that comment. Cass?
Yes. Regarding the question on intermittent fasting, I'm sorry, what's the question po?
They just ask you to comment on intermittent fasting.
Okay.
Is that good? Is that good, bad? Is it,
Okay. So actually, personally, on the question of is it good or is it bad, I do not recommend intermittent fasting for my patients, especially if they're taking prescription medicines, because it has an effect, or it affects their medicine. Then secondly, intermittent fasting po kasi ginagamit siya usually for weight loss regimen, no? But what I recommend my patients for a weight loss diet to succeed, the general rule is that more calories out and then less calories in. But if you would try intermittent fasting, a study released by American Heart Association, if I'm not mistaken, for an intermittent diet or for an intermittent fasting to work out, it is more recommended to do it during the evening up to morning, or kung paano na natin ginagawa yung fasting mismo natin, which is wala tayong kinakain during the period of evening up to morning. So mas effective siya sa ganung way. But really, for a weight loss to work out, calories pa rin yung mini-measure natin and not the time kung kailan mo siya kinain. Yun pa rin po yung
Okay. Yes, Helen, go ahead.
Yeah, I did a lecture on intermittent fasting before and actually its effects. And actually, people have to understand where intermittent fasting came from. Intermittent fasting came from a religious practice before, where you actually try not to eat. I think Ramadan, right? You try not to eat for a period of time. And after you finish that, you celebrate. You celebrate the cleansing and you eat. But people do not actually, let's put it into perspective, and I think Cass will agree. That's the reason why we don't agree with the present way intermittent fasting is being done, because it doesn't respect where it came from. People regularly eat when you do intermittent fasting. So which means you do not try to make up for the fact that you know you're about to become starving for the next 8 or 12 hours. So they say 16 hours starving. Tama si Cass, if people who do not take breakfast or just people who have the habit, you're actually intermittent fasting. But what happens is most people take intermittent fasting as eating as much as I want during the time that I can eat. So that bulks it up. So instead of putting the 4,000 calories they used to take in, let's say 24 hours, it becomes 8 hours. Subsequently, they actually, even for the ketogenic, they see some value in intermittent fasting if it's done the right way, but not for a long period of time. Not for a long period of time. And you do need a clearance before you can undergo that, because some people are definitely not for intermittent fasting, and diabetics are one of them.
Yeah.
Ketogenic diet too. There's some value in ketogenic diet, but again, Fed mentioned it. Ketogenic diet came from the concept of the Mediterranean diet. You watch the type of protein that you actually take. There are good proteins and bad proteins, and the good proteins are nuts, I think more vegetables. There are some of the good meats of a good quality, and actually very minimal meat. So I think Cass would actually agree too na if you do it right and under the guidance of a nutritionist, why not? But if you do it on your own way and your only nutritionist is Facebook, you might even face the cardiologist earlier.
Okay. Thank you for that, Helen. I guess the group really here, the viewers really want to know more about diet, and they even want to know what is the healthiest cooking oil. I remember Dr. What's this? Fernando before, he says if you want to lose weight, 4 months of zero oil. Right? I don't know how that is with you guys in the weight management section of St. Luke's, but the viewers would want to ask, if indeed we put oil, what is the healthiest oil that you can advise?
Sige. In terms of the oil that you may use, actually there's no such thing as healthiest oil, but in terms of monounsaturated fat and then polyunsaturated fatty acid that it contains, what I recommend the most to my patients is canola oil. It's either canola oil or olive oil, flaxseed oil and avocado oil. Those are the oils that contains a lot of good fat, which is the monounsaturated fat. Just try to avoid the fats that contains a high saturated fat. So examples are coconut oil, palm oil. Those are the ones that you should try to avoid. But again, of course, it depends on your recipe na rin kasi some of the recipe needs canola oil or needs sesame oil or other types of oil. You may, but remember that kailangan lang pasok tayo doon sa ating requirement. But you may add up to 5 teaspoons of oil per day. That's the general rule of thumb. But beyond that, iyon na yung kailangan nating i-compute kung pasok ba siya doon sa kailangan mo per day.
Okay. Any comments from the others, from Helen and Fed?
Yeah, basically, we classify oils based on the amount of the monounsaturated fat versus the saturated fat. And as Cass mentioned already, there are better oils. No? But again, if I cite the Mediterranean diet, the oil that they have been recommending would be olive oil. And I think there are recent studies that came out that even taking olive oil would have some beneficial effects. No? And of course, we know that certain oils can be used as dressing, certain oils can be used for cooking and so on. Although I don't cook, I'll leave the cooking to Dr. Helen Ong Garcia. But as far as the use of cooking, of course, the less oil, the better. But if you're going to use certain oils or what in terms of dressing, in terms of, I think the best would still be olive oil.
Thank you for saying that, Fed. Let me allow them to continue both as a homemaker and a doctor. And you're right, olive oil will be the best, but unfortunately, Cass mentioned it. There's a certain amount of taste that has to be taken into consideration. Not everything could be cooked with olive oil. Steaks, perhaps, some of the meats, but then the taste would matter. Number two, there's a high flammability of olive oil compared to canola oil. So therefore, sometimes you have to take that into account. You might end up with very badly prepared food because of the fact you're trying to fit it in olive oil. Canola has a certain sustainability that actually could, kaya nga na-mention ni Cass na canola, kasi you now have two choices. I don't think you have to have one oil only at home. I cook. So I do have the certain mahalang avocado, kaya hindi ko pinatulan, Cass. So again, that's another thing that you have to take into account, the cost. Most of these oils are actually more expensive than the ones that you use. Now, I would like to reiterate, I do prepare food, and you guys, some of you have tasted my food already, right? I do prepare food at home, but then the thing is, I think the amount matters on how you actually prepare your food. There might be some compromise in the quality of the food that you actually come out because you try to reduce the amount of oil you use. Then you have to be very, very creative. You might even invest in some of the machines that allow you to cook the food without actually adding a lot of oil. Another thing that probably that our audience might appreciate too is that it is not actually creativity in the woman comes in. You may not, may ask what type of oil, but frying in canola oil every day is tantamount to increasing also the oil intake that of your family does. So maybe the types of cooking that you actually have in mind should come to picture. You should appreciate the value of steaming. You should appreciate the value of actually crockpot cooking or actually grilling. So you have to be creative.
Yeah, very good. Thank you. Thank you very much. Now, Helen, because you have really been also an icon of exercise since you were young, and now you say you're in the menopausal stage. There's a question whether is it more difficult for you now in your menopausal stage to exercise? And there's also a question here that if you would prescribe or suggest an exercise for a 53-year-old woman who's obese, already told to have arrhythmia, what do you want to advise? Okay? And I guess Fed can also just jump in for this question.
I don't know whether this is an inspiration or not for everyone, but contrary to belief, I was not health buff when I was young. I was actually the fifth fattest woman in campus when I was still studying college. My transformation into health actually occurred when I was actually graduating from cardiology. Erlene would attest to that I was actually one of the bigger fellows.
Yes.
When we were
First
together.
year.
Right. I was one of the bigger and I enjoy my food. My mom is a very good cook. So I would probably say it's probably inspiring for all that it's never too late to start becoming an exercise person, because at that point in time, I was beyond my 30s already. Now, when did I become labeled as an exercise beast? Okay, I was 47 that time. I would, in all honesty, tell you I'm 58 now. So which means that yes, there are differences in the exercise you can do. Now, one thing is that I would probably advise the young one, plan ahead, because right now, I just disclosed a while ago, I cannot do lunges because my knees are actually showing itself already. So if you want to, again, the sustainability, be married to your exercise, be married to your diet, love them more than your husband. Well, not exactly on equal footing as your husband, because of the fact you're going to live with it. Now, is there a change now in my exercise? Yes. because as mentioned, there are things that I used to do I cannot do. So I modified them. The exercise that Fed mentioned a while ago, most of them are doing because they're body weight exercises. And I think that's safer for my orthopedic status. And I need not do this without any advice. I actually have now a very direct line with some of the fitness trainers, and some of them are my inaanak, and they advise me. They advise me in what is up or not. So professional advice is also necessary, because even as a doctor, you don't know. Now, regarding weight and age, and also arrhythmia, 3 conditions: 53-year-old, obese, and with arrhythmia. I would probably say, I already mentioned the obesity and the 53-year-old, you need a professional advice on what type of exercise that you need, because it has to be fit for you. We cannot have you jumping on the treadmill, because by 55, you'll feel what I'm feeling now. And it took me 10 years. Number 2, arrhythmia. Fed mentioned it very well. If you do have any medical conditions, please seek consult. Please seek clearance, because we want you to be safe. You may look beautiful, but we don't want you to be unsafe beautifully. Let's be safe and beautiful. So which means before you undergo any diet, before you undergo any exercise, seek consult first. Then if you have the clearance of your doctor, seek professional advice, or even semi-professional advice with somebody who has a learning. You don't need to go to a clinic if you need one. But you have to seek somebody who will tell you what exactly type of exercise you have to do. And that person has to be actually quite certified for that.
Yeah, thanks for that, Helen. And there's also a question about those with acute respiratory disease like asthma. Yes, they want to exercise, but it kind of gets in the way. So you or Fed can give a insight about how do you encourage them to start doing their cardio health exercises?
Well, it depends on the severity of the asthma. Number 2, whether exercise will induce the asthma attacks. No? So I think that's certain scenarios that we really have to address. No? And sometimes we need to have a clearance from a pulmonologist. And in some instances, there are patients whom we will ask them to bring their puffs, and they need to do some puffs prior to exercise. So it's like a prevention, a prophylaxis, no? Because sometimes the exercise itself can induce asthma. No? So, but again, to answer your previous question, I think it's more of like we need to customize the exercise program depending on the needs of the patient. Is the patient obese? Is the patient's weight normal? Does the patient has cardiopulmonary conditions? No? So everything I agreed with the statements of Dr. Helen, but the bottom line there is we need to customize it, because we want them, our patients, to be able to sustain. No? Because if I ask them to do very difficult exercise program, and if they're not able to do it, they would sustain injury, they would lose the enthusiasm, they will not be able to continue. The other thing is I did mention that start with a few minutes, maybe 10 minutes. In fact, I saw some studies that doing, I call it installment basis. Installment basis, like I do 10 minutes, 10 minutes, 10 minutes, 10 minutes in the morning, 10 minutes at lunchtime, 10 minutes in the afternoon. The benefits would appear the same as when I do a treadmill for 30 minutes. So it's basically customizing and making sure that our patients will be able to sustain that kind of exercise. And then after which, then we gradually increase the frequency, the interval, and the timing, and so on. So
yeah, thanks, Fed. It's really the key word that I got from you for that insight is really to individualize, to seek help, and to what Helen also said was to get screened, right? You know, exercise performance is really one of the most complex human traits because it involves all the body systems that we have, cardiovascular, musculoskeletal, respiratory, even nervous system. So I'm sure you agree that if we tell our audience here to exercise and also improve our mental state, our mental health, which now becomes a good substrate for better quality of life and taking care of our bodies. Because if you're down, we're all depressed, and especially with the COVID thing, then we don't take care of ourselves as well. So it starts with exercise, pair it with diet. Okay, so everybody listening here, there's no better time but now, right? And if I may share, Dr. Manalos, our head of our Women's Heart Health Unit, Dr. Joanna Manalo, her motto, she says, is if I don't do my exercise for the day, then I cannot eat. I cannot eat a lot, with a smiley. And because I like to eat, I make sure I exercise, laugh. Then I can eat anything I want, wink, but I still watch my portion. So I think that's a practical way of looking at things. That's Dr. Manalo's motto. But for those who already have been, like all our testimonials a while back, who have already suffered a cardiovascular event, a heart attack or a stroke, I'm sure these people are referred to cardiac rehab, right? So, but there's a question here that how can you advise those who underwent cardiac surgeries or already have been diagnosed of a heart condition? Again, it will boil down to what you have been saying, individualize it, ask for advice. But for those who are listening here, how could they probably start? Okay, they have had this, or maybe advise somebody beside them, or be an ambassador for better health for a neighbor or a friend. So can we ask our cardiac rehab specialist, Helen?
For those who actually suffered already, there are two perspectives. For those who actually already underwent a bypass, automatically, I think in the Philippines, in Manila, if you are in one of the tertiary hospitals, you have been referred to cardiac rehab for the immediate phase after bypass, because that's surgery. So the perspective lang, the reason you refer to a cardiac rehab specialist after a bypass is to make you sanay, to teach you on how to move, because you still have a wound. Now, let's say you are in the situation, you were never referred to a cardiac rehab specialist after your bypass, and then you were sent home. First and foremost, heal the wound. Don't try any strenuous activity. Usually the wound will heal within 7 days to a week. So we do 7 days to 14 days. So we advise you not to do anything strenuous with your upper extremities. Walking is the best. Walking as much as you can with what we call symptom limited exercise. So the moment you feel tired, the moment that you feel fatigue or short of breath, stop. Tama si Fed, installment basis yan. So the installment basis, it dependent yan. It's a 5-6 thing. Depende kung ano pwede mo ibigay. Walang steady installment yan. So which means that's the initial phase. If you underwent a bypass and you don't have the cardiac rehab specialist, walking is the best. When is the time that you can actually do some upper extremity exercises? We're not saying just keep stiff. You can do some exercise, nothing strenuous lang dito sa chest. We normally advise you to do that about after 2 months if you're unsupervised, because we don't want anything to happen to the wound. Now, cardiac rehab programs are available across the Philippines already. I'm not just saying St. Luke's. Even in the provinces, Cebu, even in Las Piñas, we do have them. So feel free. A bypass patient needs to be monitored. So feel free to enroll in any one of them, and you'll be actually much accelerated in terms of the way you adapt again to exercise. For those who do not have a wound, again, if you're on your own, walking is still the best exercise. Light exercises to start with, symptom limited, which means do not force it if you actually feel any, and even your relative should not force it. Kaya mo pa yan? No. We are very cautious when you're doing it at home, but please move. That's it. But be limited by your symptoms. Again, the best advice, or perhaps, is that if you have the facility of cardiac rehabilitation in your area, enroll in one.
Yeah, thank you very much, Helen. We still have a lot of questions, but for interest of time, we really have to proceed. But I think the three speakers have already showed us that a healthy lifestyle really goes a long way in preventing heart disease, and preventing it as a secondary or a primary prevention thing, diet, lifestyle choices, and other key factors that we want to really improve quality of life, okay, especially those with risk factors. So one more lang. When do you get screened? Before we stop this open forum, when do you get screened, and how often should you be screened? That's the last question I'll entertain. I'll shoot to you guys.
Screening for to start a physical activity? That's a question.
Or screening for just being healthy heart-wise.
Okay. So in any patient encounter that we do, first and foremost, of course, we assess what are the dangers that are present in that patient. No? Are there any red flags? Does the patient have any symptoms, chest pains, palpitations, difficulty of breathing, and so on? And then, of course, we do certain physical exam to see whether there are murmurs or there are signs that would warrant further investigation. We do basic tests, and if the tests are okay, there are no red flags, and then I assess what is the baseline functional capacity of the individual. What is his usual activities? What are his usual activities? Does any perform any exercise in the first place, and so on? No? So risk factors. It's an evaluation, and then that's the time we give the recommendations. No, because the bottom line there is, of course, we want to prevent, heart attack and stroke, and that's the bottom line. That's why we are discussing this, particularly for women, how we can prevent future events. No, so that's why healthy lifestyle modification is imperative, because most of the diseases that we are encountering now is what we refer to as lifestyle diseases. It's because of our unhealthy lifestyle. That's the reason why we develop those diseases.
Yeah, thank you, Fed. So that's why the formula of a healthy lifestyle is not just exercise, not just diet. It's a logical approach, systemized, professional advice probably, but logically individualized, right? So I guess we had a very good discussion now for having a healthy lifestyle. I guess women and those who love women are take-home point for you before we move on to some videos on exercise, is that don't think that this is only true for men. Okay, women are also at risk for heart disease. So get screened, be aware, and be proactive. It's like pursuing wellness as a daily goal, right? So as we close this question and answer portion, can I just ask a few words from each one before we shift to our videos? Starting with Helen, then Cass, and then Fed.
I think I'd like to reiterate to everyone in the audience. Well, the question was very valid. When do we get screened? Is there a time for health to be there? I think I'd like to pose that question. If we can actually prepare the future of our children with a very ingenious acuity as a corporate CEO, if we can actually prepare our monetary plans in life the way that we do now in investments, I think with health, it's the same. So when do we screen? There's no timing when we screen. If we have a higher risk factor, it's earlier. If you want a scientific way for women who are actually going to undergo menopause, I guess 40 years old is a good cutoff if really you are very busy. But taking a very good screening every year after the age of 40 will ensure you're healthy and hot until the time you reach 80. Subsequently, I guess there's no timeline when you can actually, I always say, there is no retirement from life. There's always retirement from work. And definitely there's no retirement or resignation from a healthy lifestyle.
Yes.
Okay, so in addition, on the question of when is the best time to seek for help, the answer is now. And also remember that there's no such thing as good or bad food or best or worst food to eat. You just have to consider the amount of food that you're eating and to have a sustainable diet or a diet na kaya mong panindigan for a long time. There's no need for so much restriction on what to eat. You just enjoy eating and you just consider the amount that you're eating. That's it.
Thank you.
Yeah, for me, I'll just use the slogan I used in my last slide. The time is now, then just do it. Parang Nike ako, parang Nike.
Parang Nike.
Yeah.
Thank you very much. Let's give a big round of applause to our speakers, Dr. Helen Ong Garcia, Ms. Cass Serio, and Dr. Fed Cheng.
We now proceed to the next segment of our program. We'd like to welcome Dr. Joanna Manalo to introduce to us the 28-day fitness challenge.
Hello everyone! I would like to present our 28-day fitness challenge and nutrition guide. So from the earlier lectures, you now know that the formula for a healthy and active lifestyle is proper diet and regular exercise. And to help you with this, we created a 28-day fitness challenge. So this is the one we created in 2019. And this year, we decided to create a second version. So first, in the nutrition guide, each day contains a nutrition tip on how to go about eating healthy, with the goal of getting into the habit of making healthy food choices. Now, the 28-day fitness challenge is divided into 4 weeks. Okay, and in each week, from day 1 to day 6, each day has a recommended exercise for the day, and it is usually a compound exercise, meaning it uses more than one muscle group. So it can use your upper and lower body muscles and even your core muscles. And this exercise can be repeated several times in the day. And then on day 7, you will do the HI or the Heart Institute 5-minute workout, also known as the High Five workout. So it consists of 10 exercises, and each exercise will be done for 20 seconds and followed by a 10-second break. So it is a full body workout because it targets all the muscle groups, and it consists of both cardio and resistance exercises. So you can also build your muscle. Okay, as you learned, muscles are important because it helps you burn your fat faster. Now, this workout can be repeated several times, so you can complete the 25 to 30 minute daily requirement, which is recommended by the American Heart Association. So you can repeat it 5 times or 6 times to get 25 to 30 minutes. Or you can add the exercises that you did throughout the week, and then you will end up with a very good workout for the day. Now, to give you an idea how this High Five workout looks, we created a video. Okay, so let me show it to you.
Hi everyone, I'm Coach Jim.
And I'm Coach Shirley. Welcome to St. Luke's Medical Center's Heart Institute 5-minute workout, or also known as
the High Five workout. With everyone, first exercise. Here we go. 3, 2, 1. And march your fists.
Good job, everyone. Doing good. Keep it up. Active breath. As much as please. Catch your breath. And breathe.
March your fists. 3, 2, 1. And march your fists.
And don't forget to smile. Woohoo! Good job, everyone. Doing good.
Ready? 2, 1. And march your fists. position. And march your face. Okay, hands up. Three, four, five, and six. Other side. Go. And march. Okay, got spot position. Arms here. Up. And march your face. And squat and go. Four, five, switch. And start. Ready? And go. 1, 2, 3, 4, 5, 7, 8, 1, 2, 3, 4, 5, 7, 1, 2, 5, 6, 7, 8, 7, 8, 3, 4, 5, 7, 8.
So that was the high 5-minute workout. So you can see it is a full body workout. Now, but it is important that you have to listen to your body, especially if this is the first time you're exercising or you're not used to it. Okay, you don't have to go as fast as the coaches did. You can go at your own pace. Okay, you can do a modified version of the exercise, and you may or may not use weights. Okay, and if you don't have weights, you can use water bottle or anything else that you can use as weights. The important thing is that you have to do it regularly. You have to be consistent, and eventually you will be able to complete the full workout, and you may even be able to do it at a higher intensity. Okay, so now this high 5-minute workout can be part of your daily routine already, especially if you don't have the time to do a 25 to 30-minute exercise. This 5-minute full body workout can get you started in the day, okay, when you wake up, or even when you're in the office and you need to take a break and stretch your muscles. You can do this to perk you up, to help you get you going again throughout the day. So we hope that this 28-day fitness challenge and our nutrition guide can get you started on your journey towards a healthy lifestyle. Okay, so this 28-day fitness challenge and the nutrition guide, both the one this year and the one last year, together with the videos. There is an instructional video that comes with it. All of these will be posted on the Facebook page of the Heart Institute of St. Luke's Medical Center Global City. If not, you can call us at the Women's Heart Health Unit here at the second floor of St. Luke's Medical Center Global City, and we can give you a copy of the workout. So guys, stay motivated and stay disciplined. And remember that if you run for your heart, then your heart will run for you. So, let's get started.
Thank you. Thank you, Dr. Manalo. You are truly an icon of overall wellness. As head of the unit of St. Luke's Heart Institute Women's Heart Health Unit. Well, we've seen it. We need to just embrace every stage in life, prepare for menopause. It's a privileged phase to reach. Choose what you eat, mo bava, moderation, balance and variety, and just move it. Now, before we call in Dr. Joanna Manalo for her closing remarks, I would want to just share what wearing red means. It's a pattern from the US Initiative for Heart Health, Women's Heart Health. Go red, go red. G is get your numbers. Ask your doctor to check your blood pressure and cholesterol. O, own your lifestyle. Stop smoking, lose weight, exercise, and eat healthy. It's up to you because no one can do it for you. R is realize your risk because we think it won't happen to us, but heart disease kills one of 3 women. E, educate your family. So make healthy food choices for you and your family. And D, don't be silent. Tell every woman you know that heart disease is our #1 killer. So we thank you all. And now I give you Dr. Joanna Manalo for our closing remarks.
Hello everyone. We have come to the end of our lay forum for this year, and we hope you learned a lot. I think the main takeaway for today is that age is just a number, and we should not let age dictate what we can and cannot do. As was mentioned in the first lecture today, even if things come in hot flushes or flashes, you are still hot. And you can achieve this by having a healthy lifestyle. And this will include eating healthy and exercising regularly. And our 2 speakers gave us very helpful guidelines on how to do this. And we hope that our 28-day fitness challenge and our high 5 workout can get you started on your journey towards a healthy lifestyle. Now, first and foremost, I would like to thank our speakers for today, Dr. Helen Ong Garcia, who is forever young and forever hot, to Dr. Frederick Cheng, who literally walks the talk. Do you know that he does not take the elevator? When he does his rounds, he takes the stairs, both going up and going down. We should all be inspired by him. To our nutritionist, Miss Cassandra Serio, Cassie, thank you for your tips on what to eat and what not to eat. I hope I myself can follow those tips. You make it sound so easy, but I know that it is not. To Coach Jim and Tony Saret, thank you for accepting our invitation to do the high 5 workout. And of course to our moderator, Dr. Erlene Demere, my lifesaver, for her support with no questions asked. And I realized that she is also our gateway to the stars. So Doctora, thank you. I am forever grateful. Special thanks also to Dr. Nick Cruz for once again providing us with very beautiful red face masks for Wear Red Day. But more than that, for being a staunch supporter of our advocacy from the beginning. As he would say, the care of a woman's heart is also a man's job. And of course, to our director, Dr. Lenny Ibulyundi, who has always supported us. The unit has a special place in her heart, and she has a special place in our hearts. I would like to also thank my Women's Heart Committee, Dr. Abby Te Rosano, for her technical know-how and her artistry, and having you around has made things easier for me this year. To Dr. Edna Lim, who even if she is at home, has always had invaluable input with regards to our activities. And of course, to my fellows, Dr. Sam Delgado, who has been able to keep up with all of my ideas. I see a future leader in her. And likewise to Dr. Quinette Mateo, who went out of her way to make sure that things got done. Same with Dr. Angie Lim and Dr. Danica Lecano, whose persistence has made sure that we had lectures for today. Thank you guys, and it was a job well done. I would also like to thank the marketing staff of St. Luke's for your patience and understanding of our ideas and our demands. And of course, I would like to thank our generous sponsors this year, to Nature Farm for taking care of the technical logistics to make sure that everything runs smoothly, to Getz Pharma for getting Coach Tony and Jim Saret to make our workout video, to LRI TheraPharma for providing food baskets for our speakers and our patients who gave testimonials, also with Sanofi, who also gave food baskets for our speakers, and to EuroAsia for sponsoring our very beautiful tote bags. Thanks to all of you, and we look forward to a continued partnership in the future. But most of all, I would like to thank you, the participants who joined us today. You have now empowered yourself to fight against heart disease. So remember, by recognizing the symptoms and the risk of heart disease, and making lifestyle changes, and getting timely care, that you can save a woman's life. So if you want to know more about heart disease in women, call us or come visit us at the Women's Heart Health Unit here at the second floor of St. Luke's Medical Center, Global City. Stay in touch with us and look out for more activities of the unit on the Facebook page of St. Luke's Medical Center or the Facebook page of the Heart Institute of St. Luke's Medical Center here in Global City. So once again, thank you to all of you, and I hope to see you all again next year. Take care, everyone.
And that ends our Wear Red Day event, the Heart of a Woman Lay Forum. Special thanks to St. Luke's Heart Institute, Global City, Manuel and Grace Palaganas Women's Heart Health Unit, and St. Luke's Medical Center, Global City. We bid you all farewell, keep safe, take care, and God bless.
Di ba normally when it's a heart attack, it's here daw, or masakit yung chest, parang may mabigat.
Lagi akong hinihingal, which na dati naman po hindi ako hinihingal.
I felt heaviness in my chest for the first time.
I felt relieved because at least it was diagnosed.
Very anxious, very scared.
This was very unusual. It was the farthest thing from our minds na it was a heart attack.
Nagpa-2D echo po ako. Nag-stress test din.
I have 3 vessel black artery. Sabi nung cardio, kailangan na ng bypass.
So altogether, 7 blockages, which they put stents in.
Lumakas naman ako, hindi na ako hinihingal. It was as if nothing has happened to me. I mean, it was an immediate relief.
Parang kung brand new machine. I was doing boxing, I was doing intense, nag-HIIT ako, ganyan.
We should all listen to our body. Anything unusual, you go to your doctor and have it checked. Maganda, magpa-check up agad kung may nararamdaman kahit konti.
Whether there's a symptoms or not, because this is a good way of preventing the possibility of having a heart disease.
I feel secured with the results that I get.
I'm confident sa state-of-the-art facilities ng St. Luke's. Saka, yun, sa mga specialized doctors nyo.
As soon as I said heart, chest pain, they immediately put me up in the front of the line. I would certainly recommend going to the most state-of-the-art hospital in the Philippines. And I think that's St. Luke's.
Hi everybody, it's Martin Rivera reminding all of you to please wear red on the first Friday of February to raise awareness of women's heart health. A healthy heart of a woman makes her hot. No?
Hi everyone, this is Tirso Cruz III asking you to please wear red this first Friday of February to raise awareness about women's heart health. A woman with a healthy heart is beautiful. Let's all help out.
Yes, hello guys, this is John Arcilia and I would like to invite everyone to wear red on the first Friday of February. It is to raise awareness on women's healthy heart. Because for me, women with healthy heart means a healthy community. So there, don't forget, wear red on the first Friday of February.
Hi, this is Lorna Tolentino inviting everyone to wear red today, February 4, 2022 to help raise awareness on women's heart health. Thank you!